Good morning, colleagues. The subcommittee will now come to order. We're meeting today to consider 13 health bills. Today is actually the first markup of our subcommittee in this year, in 2020. Since our last markup, our subcommittee has been remarkably productive. We've held 8 hearings to consider 50 bills. So today we're going to continue that progress by marking up 13 bills to improve the healthcare coverage and health care of the American people, while also improving access to affordable and safe products regulated by the FDA. Nearly every bill we'll consider today is bipartisan. We'll begin with the Cosmetic Safety Enhancement Act, which updates an 80-year-old federal law to increase federal oversight over the safety of cosmetics. Next, we'll consider 4 bipartisan bills to improve the drug supply chain. I think you all know that that's a top-line priority for me, from the very beginning of the chain to the very end, so that patients have access to quality products that are accurately labeled. The Modern Labeling Act will make sure generic drugs have up-to-date safety labeling, and the Safeguarding Therapeutics Act will protect against counterfeit medical devices. The National Centers of Excellence in Continuous Pharmaceutical Manufacturing Act supports the development of continuous manufacturing technology to strengthen and modernize U.S. drug production. The Fairness and Orphan Drug Exclusivity Act will close a loophole so that orphan drug exclusivity cannot be used to deny access to drugs for opioid use disorder. Next, 4 bipartisan bills aim to prevent the single greatest tragedy a family can experience, the death of their child. The FASTER Act requires food manufacturers to list sesame as an allergen on their products. An estimated 8% of American children have food allergies, and the NIH recently found that sesame allergy is common among those children. Without clear labeling, they are at risk for a serious allergic reaction, even death. The School-Based Allergies and Asthma Management Program Act also helps children at risk for allergic reactions by preferentially awarding children's asthma treatment grants to states whose public schools are ready to handle asthma and allergy emergencies. We'll also mark up the Scarlet's Sunshine Act. No family should suffer the death of a child without knowing why. And we had very powerful testimony on this issue. Yet over 400 children and 3,600 infants die each year from unexplained causes. The Scarlet Sunshine Act provides funding to improve data collection and death scene investigations related to unexpected deaths and promotes safe sleep practices. The Healthy Start Reauthorization Act invests $135 million annually to improve birth outcomes in high-risk communities. The Healthy Start program has reduced rates of low birth weights, preterm births, and prenatal opioid exposure. The Ensuring Lasting Smiles Act helps the 4% of children who are born with congenital anomalies such as cleft palate. Health plans often deny or delay claims for children with dental-related procedures. This practice leaves families in debt from high out-of-pocket costs despite paying for health insurance that should cover these procedures. The final 3 bills reform core pieces of the Medicare and Medicaid program. The Bennies Act updates the Part B enrollment process for the first time in 50 years. It requires Medicare to notify people nearing eligibility about their rights and responsibilities, protecting beneficiaries from a lifetime of financial penalties for failure to enroll promptly. That's quite a change for the first time in 50 years to update Part B enrollment. The Protecting Patients Transportation to Care Act requires state Medicaid programs to offer a non-emergency medical transportation benefit. Transportation to health services is a lifeline for patients, especially those who live in rural or underserved areas, with so many members representing those types of communities. While Medicare covers a lifetime of dialysis, kidney transplant recipients currently lose their Medicare coverage 36 months after transplant. This doesn't make any sense. The comprehensive immunosuppressive drug coverage for kidney transplant patient act closes that coverage gap. A nonpartisan HHS analysis found this policy would save 375 kidney transplants each year. So today's markup is bursting with common sense legislation, and I'm proud that we're advancing these 13 bills and continue our record of bipartisan productivity. And of course, I urge my colleagues to support them. And with that, I yield back the time that I don't have, and now move to recognize Dr. Burgess, the ranking member of the... All right. I'll do that. Be happy to recognize the gentleman from Oregon, the ranking member of the full committee.
Thank you, Madam Chair.
Yes.
At today's subcommittee markup, as you said, we'll advance these 13 proposals to improve health outcomes, improve safety and access to medical products. 3 of the bills before us today are bipartisan initiatives that advance health, public health and wellness in children. H.R. 2271, the Scarlet Sunshine on Sudden Unexpected Death Act, improves our efforts to further understand both sudden unexplained infant death and sudden unexplained death in childhood. H.R. 4801, the Healthy Start Reauthorization Act, authorizes grants for services and supports that reduce infant mortality and improve pregnancy outcomes. And finally, H.R. 2468, School-Based Allergies and Asthma Management Program Act, permits the Departments of Health and Human Services to give preference in asthma grants to states with comprehensive school-based allergy and asthma management programs. So I'm pleased the committee has worked together in a bipartisan fashion to advance these bills that will help improve health outcomes in our children. We will mark up several bipartisan priorities that aim to improve the safety of America's medical product supply chain and improve patient access to treatments. H.R. 5663, the Safeguarding Therapeutics Act, will protect Americans from dangerous counterfeit medical devices by extending the FDA's authority to administrative destruction authority to those products. H.R. 4866, the National Centers for Excellence in Continuous Pharmaceutical Manufacturing Act, will provide the agency with tools to promote the development and implementation of advanced manufacturing technologies, which have the potential to increase our manufacturing resiliency and reduce quality issues that often trigger drug shortages. We'll also mark up 3 bipartisan bills that increase patient access to essential services. Those are H.R. 1379, the Ensuring Lasting Smiles Act. It provides children with congenital anomalies access to medically necessary treatment. This is an important cause, and nobody should be denied medically necessary coverage for a congenital anomaly. I know my friends on the other side of the aisle have agreed to work with us in a bipartisan way to make sure the bill is drafted in a way that does not swing the door wide open to coverage of all sorts of cosmetic services, and we believe that's important. I appreciate their commitment to working toward this shared goal before we get to full committee markup. But for the patients supporting this bill, we want to help, and we want to get this right so they can access the care they need. H.R. 2477, the Bennis Act, provides greater outreach to beneficiaries eligible for Medicare Part B and works to limit enrollment penalties they face if they do not sign up on time. We want to make sure the full range of options, including Medicare Advantage plans and other private sector options, are available to seniors to avoid late enrollment penalties, and we'll keep working with my friends across the aisle as this bill goes forward as well. We'll also consider a bill introduced by Mr. Carter, H.R. 3935, the Protecting Patients' Transportation to Care Act. Now, this bill would codify in Title 19 of the Social Security Act the longstanding mandatory Medicaid transportation benefit. We'll introduce a bipartisan amendment at full committee markup, Madam Chair, that will add critical program integrity measures as well as technical assistance. And I want to thank Mr. Carter for his work and leadership on this issue. We'll also consider H.R. 5534. That's a bill introduced by the ranking member of the Health Subcommittee, Dr. Burgess. This measure will fix disparities in Medicare coverage for individuals who've received kidney transplants and currently only receive 3 years of coverage for immunosuppressant drugs. Extending coverage to these drugs is cost-effective and will result in better outcomes for those with kidney transplants. More opportunities to move people off dialysis through transplants will immeasurably improve the overall health and quality of life of those suffering from end-stage renal disease. Additionally, we'll move forward with 2 bills that help address barriers to treatment. H.R. 5668, the Modern Labeling Act, that will allow for the updating of outdated drug labels so providers have the most up-to-date information when discussing treatment options with their patients. H.R. 4712 will close a loophole in the Orphan Drug Act that may enable drug companies to block competition by claiming their drug may not be profitable, despite a demonstrated ability to rake in billions. We'll also mark up H.R. 5279. Now, that's the Cosmetic Safety Enhancement Act, and I appreciate the ongoing discussions the majority has engaged in with respect to cosmetics regulation. I hope conversations continue to progress and that we can find solutions to address issues that are still unresolved, and there are those issues. Among those are ensuring the legislation includes strong federal preemption language and an appropriate exemption for small businesses. These are issues I believe to be critical in achieving bipartisan agreement, so I look forward to advancing these measures today and continuing our bipartisan conversations to address outstanding concerns before reporting these bills out of committee. With that, Madam Chair, I yield back.
The gentleman yields back. It's a pleasure to recognize the gentleman from New Jersey, the chairman of the full committee, Mr. Pallone.
Thank you, Chairwoman Esch, and I want to thank you for working so hard to get these bills together and having hearings and bringing this important legislation to us together in the Health Subcommittee today. We're continuing today with this committee's work of putting consumers first by improving the safety of our nation's food, drugs, medical devices, and cosmetics. We're also going to strengthen coverage and benefits for Medicare and Medicaid beneficiaries. The bills we're marking up will take great strides towards achieving these goals, and I thank my colleagues on both sides of the aisle for the hard work on these 13 proposals. The subcommittee will consider a number of bills aimed at empowering the FDA to protect consumers and require that the products Americans utilize every day are safe and marketed with accuracy and transparency. So first, we'll consider the Cosmetic Safety Enhancement Act, which I introduced last year to improve and advance the safety of cosmetics and other personal care products. Congress has not updated FDA's authority to regulate these products in over 80 years, and it's long past time that we act so that we can ensure consumers are safe and have confidence in the products that they use every day. We'll also consider the Modern Labeling Act of 2020, introduced by Representatives Matsui and Guthrie. This bill gives FDA the authority to require modifications of outdated labeling for generic drugs in order to ensure they represent accepted clinical uses. Representatives Guthrie and Engel have a bill that would allow FDA to destroy medical devices found to be adulterated or misbranded. The FDA already does this with drugs, and this will keep potentially harmful medical devices from entering the supply chain. We also have a bill introduced with Mr. Guthrie that, this is my bill with Mr. Guthrie that directs FDA to designate national centers of excellence in continuous pharmaceutical manufacturing. These centers will help limit drug shortages in the future while spurring a new generation of manufacturing jobs here in the U.S. And then we have a number of bills that aim to improve health outcomes for kids. The first, introduced by Representative Matsui, requires the Center for Disease Control and Prevention to expand the collection information as to the prevalence of food allergies and includes sesame as a major food allergen. Another bill would create a program to promote asthma and food allergy management and treatment in schools. We also strengthen existing efforts to better understand sudden unexpected infant death and sudden unexplained death in children. And this bill would streamline data collection and analysis to improve prevention efforts and support for children and families. And we have another bill to reauthorize the Healthy Start program to reduce infant mortality and improve perinatal outcomes. And finally, we have 4 bills to expand coverage of vital health care programs. We require all individual and group market health plans to cover medically necessary treatment resulting from congenital abnormalities or birth defects. We'll improve outreach and education for individuals approaching Medicare eligibility. And then we also remove the 36-month limit for Medicare coverage of immunosuppressive drugs following a kidney transplant. And we include transportation in the list of mandatory Medicaid benefits. Those are 4 additional bills. So I just want to thank again Chairwoman Eshoo and all the members for the leadership on these bills. I urge my colleagues to support them, and I yield back.
The gentleman yields back. It's a pleasure to recognize the ranking member of the subcommittee, Dr. Burgess.
I thank the chair. This markup this morning does include some important work, and I'm thankful that we'll continue to move it through the Energy and Commerce Committee. An important bill, H.R. 5534, the Comprehensive Immunosuppressive Drug Coverage for Kidney Transplant Patients Act of 2019, is something that I've been working on for nearly a decade. In 1972, Congress enacted legislation to allow certain individuals with end-stage renal disease to enroll in Medicare. This was the first time an individual under the age of 65 would be eligible to enroll in Medicare due to a specific medical diagnosis. Medicare beneficiaries with end-stage renal disease only make up about 1% of total Medicare enrollment, but they account for 7% of Medicare fee-for-service spending. These patients can be incredibly ill and oftentimes have several other costly other chronic medical conditions. A kidney transplant is an investment. It's an investment that the government makes into that patient's future. Medicare pays for the patient's kidney transplant if they have the end-stage renal disease benefit, and that transplant should be a solid investment in the future health of that patient. Unfortunately, the investment is lost, and the patient's health is jeopardized if they cannot get their immunosuppressive drugs and reject their kidney transplant. So we should protect that investment. Currently, Medicare only covers immunosuppressive drugs for 36 months. However, these patients require these drugs for the rest of their lives. H.R. 5534 directly addresses that problem by extending Medicare coverage of immunosuppressive drugs past the 36-month limit for patients who do not obtain health care coverage elsewhere. This is a policy that has significant support from everyone from patients to the transplant surgeons, and it is something that the kidney community has coalesced behind for several years. Last July, I attended the launch of President Trump's Advancing American Kidney Health Initiative, which aims to improve care, foster innovation to benefit kidney patients across the country. So this policy, H.R. 5534, aligns with the goals of the administration. In fact, both the Center for Medicare and Medicaid Services and the Office of the Actuary and the Office of the Assistant Secretary for Planning and Evaluation at Health and Human Services have published reports on the benefits of extending Medicare coverage of immunosuppressive drugs, which include financial savings for the Medicare program. So this is the time to make a difference in the lives of kidney patients. H.R. 5534 will deliver those marked improvements in the lives of patients with end-stage renal disease, and of course, it positively affects their families as well. So I really want to see this move through the Energy and Commerce Committee and the next step toward becoming law. We do have other bills before us today, and to help provide American patients with the care that they need, Representative Carter, H.R. 3935, would continue the requirement that state Medicaid programs provide coverage of non-emergency transportation for medically necessary services. Important bills that will help families and children, such as 2271, the Scarlet Sunshine on Sudden Unexpected Death Act, and H.R. 2468, the School-Based Allergies and Asthma Management Program Act, and H.R. 4801, the Healthy Start Reauthorization Act of 2019. Other bills will help deliver safe and effective pharmaceuticals and medical devices to Americans, such as Representative Guthrie's H.R. 5663, the Safeguarding Therapeutics Act, and H.R. 4712, the Fairness and Orphan Drug Exclusivity Act, and 4866, the National Centers of Excellence in Continuous Pharmaceutical Manufacturing Act of 2019, and that has grown in importance since the non-availability of active pharmaceuticals from mainland China because of the effects of major illness over there. So this bill is timely and is one that this committee would do well to advance to the full committee. Our supply chain and pharmaceutical manufacturing, and in fact, medical devices, all need to be available and safe. So these pieces of legislation are important to public health protection by allowing the Secretary to destroy certain counterfeit medical devices, protect orphan drugs, and improve continuous manufacturing capabilities. In the midst of discussions about ensuring a robust and insurance healthcare workforce in the wake of coronavirus, it is disappointing that we are not including a bill that I introduced with Chairwoman Eshoo, H.R. 4870, the United States Public Health Service Modernization Act. This bill would provide retirement benefits, rights, and privileges to our hardworking and necessary Ready Reserve Corps. So I thank the chairman for holding this markup today. I hope we can move on the IR bill because I do think it is important at our next markup, and I'll yield back my time.
The gentleman yields back. Do other members seek recognition to make an opening statement? Recognize the gentleman from California, Mr. Cardenas, for 3 minutes.
Thank you, Madam Chair and Ranking Member, for all of your hard work for moving forward on these extremely important bills. Too often we hear about what divides us versus when it comes to Democrats and Republicans, urban versus rural, but today we have multiple examples of what we do as we come together once again. In particular, I'm proud of the work that I have done with my colleague, Congressman Carter. Anyone who watches our committee hearing on a regular basis knows that there is much that we debate and agree and disagree on. But on this, on making sure Americans not only have financial but physical access to the care they need, we both strongly agree on. During the legislative hearing on this bill, we heard the experts say that this is an issue that impacts Americans of all races and all regions, and also rural and inner city. The non-emergency transportation benefit can be a lifeline for Medicaid beneficiaries who may not be able to afford other means of transportation. Don't let the name fool you. For people who need to see the doctor to get regular treatments or access their pharmacy for life-sustaining medications, this can be an issue of life and death. I thank and appreciate all of my colleagues for your work in advancing this legislation and the other 12 bills that we're hearing today. I'd like to also emphasize that we're hearing the Cosmetic Safety Enhancement Act of 2019, Making Objective Drug Evidence Revisions for New Labeling Act of 2020, Safeguarding Therapeutics Act, National Centers of Excellence in Continuous Pharmaceutical Manufacturing Act, Fairness and Orphan Drug Exclusivity Act, Food Allergy Safety, Treatment, Education, and Research Act of 2019, School-Based Allergies and Asthma Management Program Act, Scarlett's Sunshine on Sudden Unexpected Death Act, Healthy Start Reauthorization Act, Ensuring Lasting Smiles Act, Beneficiary Enrollment Notification and Eligibility Simplifications Act of 2019, Comprehensive Immunosuppressive Drug Coverage for Kidney Transplant Patients Act, and my favorite for today's hearing, Protecting Patients' Transportation to Care Act that I'm co-authoring with Congressman Carter. I wanted to read those off, ladies and gentlemen, because tonight, tomorrow, last night, and for too long, we have seen and heard the American public being told that we do not work together in Washington. And today is a perfect example that we come together. Yes, we debate. Yes, we agree, but we also disagree sometimes. But today we are working in a bipartisan basis. Some of us might wear loud plaid, and some of us might wear just basic colors. But the bottom line is we are all Americans, and we love this country, and we are serving every single American equally. Thank you very much, Madam Chair and Ranking Member. I yield back.
The gentleman yields back. We've all noted Mr. Hudson's beautiful jacket, Madras jacket, and it still fits him. And that's from what? College or high school? College. Okay. This is in honor of
Howard Coble. I was going to ask.
Howard Coble.
I was going to ask permission to talk about that. Yes.
I had one like that too, but I think I gave it away a long time ago.
Just don't want you picking on my colleague from North Carolina.
No, I
Yeah.
wouldn't. I complimented him on it.
Yeah.
I think it's great.
He has a good motive
It's
today.
a revival of Madras today. Is there anyone on the Republican side that would like to be recognized for an opening statement? All right, seeing none. On our side, Ms. Berrigan. Right? Is she next? Yes. The gentlewoman from California, Ms. Berrigan, 3 minutes.
Thank you, Madam Chair. I just want to briefly thank you for holding this hearing that's so critically important, in particular, the Cosmetic Safety Enhancement Act. I don't think when women or young girls go to buy cosmetic products, whether it's powder, makeup, or hair straightening, that they would ever think that there would be something dangerous in the product. And so to hear about what's been happening and to read about it, I'm proud that we are addressing that issue today with this bill that will provide the FDA the tools that they need to do proper oversight on cosmetic problems, on the cosmetic products. It's people of color who sometimes are disproportionately impacted and use these products. But when you hear about young girls and what's going on, their hair falling out, going bald after 3 weeks from using it, it's necessary for Congress to step in. And so I'm glad that we're able today on a bipartisan basis address this issue, and just wanted to thank you for your leadership and this committee's leadership on this issue. And with that, I yield back.
The gentlewoman yields back. Anyone on the Republican side wish to be recognized? Not seeing anyone. On our side, the gentleman from Massachusetts, Mr. Kennedy, for 3 minutes.
Madam Chair, thank you. And I want to thank Ranking Member Dr. Burgess for convening this markup today and for your diligent work on passing this package of bills. To the members and staff who drafted, amended, and built support for all of these pieces of legislation, thank you for working day and night to turn these ideas into reality. From food allergies to orphan drugs to patient transportation to labeling protections, the bills we're debating and discussing today will improve our healthcare system and make real differences for countless Americans of all ages. Specifically, the Scarlet Sunshine on Sudden Unexpected Death Act holds a place close in my heart because of a young dad I met back home who told me about his son, Luke. A young boy with a bright future and an even brighter smile. A son who never made it to his 19th month. A gaping hole left in his parents' hearts with little explanation. Until one day, his family found a Boston-based research program that helped his family determine a cause of death, sudden, unexpected death in childhood, with evidence consistent with an epilepsy pathway. And this father stood there and told me how fortunate he was because at least they were lucky enough to find a cause of death for his little boy that he would never see again. Fortunate. No parent, no sibling, no human being. No one would want to hear that story from a dad and think that he is fortunate. Today, by advancing Congresswoman Moore's bill to the full committee and eventually to the House floor, we'll do our part to reduce the number of parents who will tell a story like the one I heard from that young man. And fewer still will need to consider themselves fortunate to be among the few to hear a cause of death. Thank you to my colleagues that help us reach this point. I yield back.
The gentleman yields back. Are there any other members that wish to make an opening statement? Seeing none, that concludes our opening statements, and all members already know this, but we'll still state it for the record, that pursuant to committee rules, members' written opening statements shall be made part of the record, and you should submit that written opening statement to the clerk's desk. At this time, we'll begin bill consideration. The chair calls up H.R. 5279, the Cosmetic Safety Enhancement Act of 2019, and the clerk will report the title, please.
H.R. 5279, a bill to amend the Federal Food, Drug, and Cosmetic Act to improve
Without objection,
cosmetic
the first
safety and
reading
further
of the
purposes.
bill will be dispensed with, and the bill is now considered read. Without objection, the bill is considered as read and open for amendment at any point. The chair will now recognize Mr. Pallone to offer an amendment in the nature of a substitute, and the clerk will report.
Madam
the
Chair, I wanted to
amendment.
strike the last word before we went to amendments.
I'm sorry.
Is that,
I didn't hear you.
I wanted to strike the last word on the bill before we went to amendments.
That's, recognize the gentleman to do so.
Thank you, Madam Chairman. I've been working with Chairman Pallone and his team on the Cosmetic Safety Enhancement Act of 2020, and although we've had some great discussions, we're not there yet. We share the same objectives. We want federal regulators to make safety determinations and complete a risk evaluation based on sound science, not emotion or politics. I've had three main priorities as we've worked over this past year. They're very similar to the priorities we used in the when we reformed TSCA, and I hope we continue to kind of move down that pathway. Preemption. FDA is the most competent regulator in the nation. If they determine something is safe or unsafe, states and local governments should respect that decision. This continuity is not only important to business operating nationwide, but also to avoid consumer confusion. Protecting confidential business information. We're working to strike a delicate balance between the needs of the FDA in gaining access to the data and information necessary to make sound scientific decisions and protect public health without undermining the important commercial role of intellectual property and trade secrets. User fees. Obviously, this work will have a cost, but fortunately, manufacturers are willing to pay FDA to do this work. I'm encouraged that progress is being made to contour the user fee structure to ensure regulated entities are receiving appropriate value and not disproportionately burdening any particular segment of the market. And I think we've had some great work on small business exemptions, which I appreciate. So we look forward to moving this bill forward. We hope that we can get some more agreement in these other provisions. And I want to yield to my colleague, Mr. Guthrie.
Thank you, Mr. Shimkus. I appreciate that. I'm also concerned, and I've been working with a group of bipartisan members to reform the outdated over-the-counter monograph program. And I'm concerned that as drafted currently, this bill would provide greater ambiguity between a cosmetic and an over-the-counter medicine. For example, there are many products on shelves today that could be considered both an over-the-counter and a cosmetic. Should over-the-counters not be carved out from the cosmetics reform, over-the-counters could very likely face duplicative regulation and potential for duplicative fees, not to mention cause great confusion at the FDA regarding who has jurisdiction over these consumer health care medicines. Some examples of affected products could include anti-dandruff shampoo, some toothpastes, and sunscreens. I appreciate my friend from Illinois yielding me a couple of minutes, and I yield back to him.
Madam Chairman, I yield back. Thank you.
The gentleman yields back, and the chair would like to thank Mr. Shimkus for the work that he's doing with Mr. Pallone to work out the differences in the bill so that we can actually take it up. I'll go back to what I said before. I'll now recognize Mr. Pallone to offer an amendment in the nature of a substitute. The clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 5279 offered by Mr. Pallone of New Jersey. Strike all F.
Without objection, the reading
enacting
of the
clause.
amendment will be dispensed with, and Mr. Pallone is recognized for 5 minutes.
Thank you, Chairwoman Eshoo. And let me just say, before I talk about the Ains, I want to thank Mr. Shimkus for, all he's done working with us. We will get there. I like your analogy with TSCA, which we worked on for so long, and we finally did get there. Preemption, I know, is a major issue that we have to deal with before we get to full committee. And I also wanted to say to Mr. Guthrie, we continue to be working on the over-the-counter. There are some provisions in the bill today with regard to state compliance and standards for over-the-counter, but we'll continue to work with you as well, and I think we can get there before we get to full committee. Let me say it's been a long road to get to the point where we are today, but I am pleased that over 80 years since the passage of the Federal Food, Drug, and Cosmetic Act, the Congress is acting to modernize the regulatory framework for cosmetics. The cosmetics marketplace has changed dramatically since FDA was first granted authority to oversee these products. Today, this is an $80 billion industry whose products are used every day by American families. Yet these products have not been subject to any type of review prior to coming to market. Instead, we rely on manufacturers to undertake the necessary studies to demonstrate safety and ensure that they're appropriate for the uses and populations that they say they are. And the public doesn't realize this. The public thinks that the FDA regulates cosmetics the way they do drugs or medical devices, and it's simply not the case. The limitations of FDA's authorities have hamstrung their ability to respond in the face of risks or harms to consumers. There have been public instances of shampoo causing women and girls' hair to fall out, hair treatments found to release formaldehyde, or girls' makeup being contaminated with asbestos, just to use a few examples. And in these instances, FDA has had to ask the manufacturers to act and hope that they complied, and in one instance only discovered records of thousands of complaints when the agency went to inspect. H.R. 5279 sets out to change this by providing FDA with key basic regulatory authorities similar to what the agency has done for other products it regulates, and that is requires manufacturers to notify the agency about adverse events, compels manufacturers to register information about the facilities they operate and the products they market and sell, ensures any adverse events associated with cosmetic products are sent to FDA within 15 days, gives FDA basically recall authority to review the safety of cosmetic ingredients and remove products from the market if they're found to be causing harm to consumers, and providing FDA with stable funding, user fees, to conduct all this new and important work. And we had a hearing on this legislation in December, and since then we've been working to revise the bill to reflect the feedback and concerns we've heard from stakeholders and to incorporate technical assistance from the FDA. The AINS now makes a number of changes in response, including requiring the disclosure of fragrance allergens on cosmetic products, providing clear timetables for FDA's ingredient review process, building in the opportunity for FDA to meet with manufacturers to support the development of data and information to demonstrate the safety of their products, clarifying the requirements for registration, streamlining the foreign supplier verification program, and providing additional guidance to small businesses. Now, we've been actively working, as you've said, with our Republican colleagues, industry, and the FDA, and I think we have made progress, but I know we still have work to do. And I'm committed to working with my colleagues as we move forward to full committee to address their concerns, and I hope they'll also work with me to build an ingredient review framework that identifies a strong, clear, and proven safety standard that would warrant the inclusion of preemption in the legislation. And I look forward to working with all of you between now and full committee to ensure we're providing FDA with the authority it needs to give consumers confidence that the cosmetics and personal care products they use today are safe for their use. And with that, I'd urge my colleagues to support the bill and yield back, Madam Chair.
The gentleman yields back. I recognize myself to strike the last word. Pardon me? Oh, I'm sorry. On the Republican side, is there anyone that would like to be recognized?
Are we on the amendment? Manager's amendment?
We are. We're on the AINS. No?
If I have an amendment to the AINS? May I offer it now?
Yeah, but she wants to strike the last word.
I want to strike the last word.
Please do.
I shall. Every day, Americans trust that the essentials that we use, shampoo, toothpaste, deodorant, and makeup, are all safe. Most businesses in this $80 billion industry, the cosmetic industry, argue that these ubiquitous products are safe and should be trusted. But that trust isn't based on independent reviews, ingredient lists, the threat of recall, or the public reporting of bad reactions. Instead, the only thing standing between Americans and a dangerous cosmetic product is an 80-year-old, not 8-year, 80-year-old federal law, the 30 employees at the FDA's Office of Cosmetics and Colors, and strongly worded letters from the FDA. So to put it bluntly, we don't know what's in our cosmetics. And what we don't know can hurt us. Nail polish has been linked to serious health and respiratory problems for nail technicians. Epidemiological studies since the 1980s have found that hairstylists are at risk for skin and respiratory diseases, birth defects, and miscarriages. Cosmetics can be contaminated with asbestos, heavy metals, including arsenic, cadmium, lead, and nickel, or contain banned ingredients like mercury. God, I'm surprised I'm still alive. FDA does not have the power to adequately police cosmetic imports despite intercepting products made with banned ingredients, including shampoos, cleaners, temporary tattoos, and eyeshadows produced with coal tar. Without federal leadership, states have stepped up to the challenge. In California, independent health groups like the California Healthy Nail Salon Collaborative have had to fight to make sure nail salons offer products free of the toxic trio of formaldehyde, DBP, and toluene. This advocacy led to the California Safe Cosmetics Act, which was the first state law to regulate cosmetic manufacturers. The 2005 law requires manufacturers to supply health-related information about cosmetic ingredients and regulates the products used in salons. Additionally, Prop 65 requires businesses to warn Californians about significant exposure to chemicals that cause cancer, birth defects, or other reproductive harm. California has fought hard for these common sense health protections. And that's why we really must ensure that any federal cosmetic reform we pass preserves states' ability to step in to protect their residents when the federal government fails to take action, as it has for the last 80 years. So I think it's time, colleagues, to pass a strong federal bill to make sure the products used by virtually every American each day are safe. And with that, I yield back the balance of my time. And is there anyone else that wishes to speak on the Republican side, on the amendment? Seeing none, we'll move to the Democratic side. Any members wish to speak to it?
I think Mr. Burgess wants to offer an amendment.
Yeah, I do have an amendment.
The chair recognizes Dr. Burgess to offer an amendment.
The amendment is a small exception 01. I have an amendment at the desk.
The clerk will report the amendment, please.
Amendment to the amendment in the nature of a substitute to H.R. 5279 offered by Mr. Burgess. Page 104, after line 10.
Without objection, the reading of the amendment will be dispensed with. And the gentleman is recognized for 5 minutes.
I thank the chair. I will say it is my intention to offer and withdraw this amendment, but during our legislative hearing, we did hear some concerns that very small businesses will face a significant regulatory burden. This might be manageable for a larger and more established manufacturer, but it could threaten the very existence of a very small business. Obviously, they have fewer resources to expend on regulatory compliance. These regulations could also restrict new entrepreneurs from entering the market. We did have a hearing in December. Several members expressed concern with subjecting small manufacturers who may only be making a product to sell at a weekend farmer's market to full FDA regulatory authority, particularly given the low-risk profile of some of these compounds. As such, this amendment would simply exempt small manufacturers with a gross annual sales of $1 million or less from the requirements under the bill, with some exceptions. Under the amendment, those small manufacturers would still be required to report serious adverse effects, include fragrance allergens on their product labels, and be subject to mandatory recall authority. So I believe this exemption strikes a reasonable balance of alleviating regulatory burden for the very small business and still preserve the FDA's authority to remove products from the market if they pose a health risk. So I certainly hope the chairman and the author of the bill will continue to work with me to address these concerns about small business relief while still ensuring that the FDA has the tools they need to ensure that any unsafe products are not in the hands of American consumers. And with that reassurance, I'd ask unanimous consent to withdraw the amendment.
Strike the last word, Madam
The gentleman withdraws his, no?
Before he withdraws it.
Before he withdraws it, I recognize Mr. Pallone.
Thank you. I appreciate Dr. Burgess' willingness to offer and withdraw. I just wanted to say something, though, in regard to his amendment. When we crafted this bill and worked on it since our hearing, we have worked to try and address some of the concerns we've heard from small cosmetic manufacturing businesses. Just to provide a few examples of areas under the legislation where we have made special accommodations for small business. Under the bill, manufacturers with less than $500,000 in average gross annual sales of cosmetic products would not be required to register their products or ingredients with the FDA, and all manufacturers with less than $1 million in sales would not be required to pay registration fees. Small businesses above that threshold would be allowed to submit simplified ingredient statements and be granted additional time to submit information to FDA and comply with current good manufacturing practice requirements. Also, the bill would require FDA to work with the Small Business Administration to provide small business guides on compliance to help these manufacturers navigate the requirements I've heard they've had most questions about, which are the good manufacturing practices, the foreign supplier verification, and submission of ingredient statements. And last but not least, because there's so many small handcrafted soap manufacturers selling their products in shops and farmers markets throughout the country, the amendment in the nature of a substitute clarifies that soap products that meet the definition of soap under FDA regulations are not marketed or sold as cosmetic products would be exempt from all the requirements of the bill. From these examples, I hope my colleagues can tell that I'm committed to working with small businesses to ensure that any new regulations are fair and appropriate. I believe it's important that FDA has the authority to ensure that all cosmetic products are safe, and while I have concerns about a carte blanche exemption from all requirements of the bill for businesses as large as my colleague would like, I'm happy to find targeted and balanced exceptions for small businesses, and I'll gladly work with Dr. Burgess and others on this as we move forward to full committee, Madam Chairwoman. And thank you. I yield back.
Gentleman yields back. Does anyone else wish to speak on the amendment?
Ask unanimous consent to withdraw the amendment.
The gentleman's request is accepted. Now we will, are there any other members that wish to speak to it? No? Or offer another amendment? Mr. Rush, you're recognized for 5 minutes. We can
I have an amendment at the desk, Madam Chair.
we can unblock the votes, can't we, on the amendments?
We can't unblock them, but we have to do all the amendments before we can do the A's.
Okay.
Madam Chairman,
Yes.
should we not vote on the amendment in the nature of a substitute before we move to other amendments?
Then you couldn't offer other, then you couldn't offer other amendments.
No, because then we can't offer other amendments. So we'll continue with the amendments and then vote.
Amending the amendment. It's amending the amendment.
Yeah, he's amending the amendment.
Oh, they're
amending the
amending the amendment in the nation of
Right.
substitute.
Right.
The gentleman from Illinois is recognized.
Well, thank you, Madam Chair. You have to read the amendment.
I have it. We have the amendment at the desk, Madam Chairman.
The clerk will read the amendment.
Amendment
Or
in the
the
nature of a
amendment.
substitute. Well, it's an amendment to the amendment in the nature of a substitute to H.R. 5279 offered by Mr. Rush. At the end of Section 608 of the Federal Food, Drug, and Cosmetic Act, proposed to be
Without
added by
objection,
section.
the reading of the amendment to the amendment will be dispensed with. The gentleman is recognized for 5 minutes.
Well, thank you, Madam Chair. Madam Chair, I was shocked to learn last December that according to the Environmental Working Group, fewer than 25% of personal care products marketed to Black women are considered to be, quote, low in potentially hazardous ingredients compared to about 40% of the items marketed to the general public, end of quote. Many African Americans, Madam Chair, many African American women and girls use hair relaxers, baby powder, and skin lightening creams, which have been found to contain dangerous ingredients and chemicals, including formaldehyde, asbestos, and mercury. The widespread use of these products, particularly in minority communities, is not a coincidence. The Environmental Working Group has found that 1 in 12 beauty and personal care products marketed to Black women are estimated to be, quote again, highly hazardous, end of quote. The consequences of using these products include cancer, developmental and reproductive damage, and hormone disruption. In this subcommittee's hearing on cosmetic safety held last year, we heard about the hair relaxing kit called Just For Me, which is targeted and used by children, and it was found to be toxic. Just For Me, Madam Chair, was just toxic for our children. Similarly, we discussed how Black and Latino women disproportionately use talc-based powder at a higher rate than white women do, at least in part to systematic and targeted marketing, including the provision of free and discounted talc-based products at churches and at beauty salons. African American women and girls have been denied a voice and a seat at the table for far too long. That is why I am offering an amendment this morning with my friend, Congresswoman Lisa Blunt Rochester, to ensure that the Office of Minority Health is consulted on which ingredients should be reviewed, as well as the scientific evidence, the clinical studies, the data, and any other information needed to ensure the health and safety of women and girls of color. Madam Chairman, I am grateful to you and to Chairman Pallone for working with me on this amendment. It is long overdue. That said, and before I yield back the remainder of my time, I feel compelled to say that I am disappointed that we had to offer this amendment in the first place. Frankly, it should have been a part of the base bill from the beginning. The Black community and Black women and girls in particular deserve better than to be treated as a mere afterthought. This amendment will go a long way to ensuring that the products used by minority women and girls are no longer tacitly accepted regardless of their potential to harm. Instead, these products will be scrutinized to ensure ingredients are safe and transparently listed. While this amendment cannot undo past harm, it will ensure that the health and safety of African American women and girls are going forward. We cannot afford to delay cosmetic reform any longer, and I urge my colleagues to join me in supporting both this amendment and the underlying bill. And I yield back the balance of my time.
Gentleman yields back. Are there any members that wish to speak to Mr. Rush's amendment? The gentlewoman from Delaware is recognized for her 5 minutes.
Oh, I was going to move to strike the last word that I've recognized, and I want to thank you, Madam Chair, for the recognition. And I'd also like to thank my colleague and friend, Congressman Bobby Rush, for his leadership and for working with me on this amendment. According to estimates by the Environmental Working Group, women use an average of 12 personal care products a day, between shampoos, conditioners, face washes, deodorant, hairspray, and makeup. That's an exposure to about 168 different chemicals. And as Isabel Chaudhry, Senior Policy Manager at the National Women's Health Network, mentioned in her written testimony for our hearing on cosmetic reform, quote, vulnerable and underserved women and girls in particular may be disproportionately affected by environmental chemical exposures. For one, African American women have been shown to buy more personal care products. While African Americans make up only 12% of the U.S. population, they spend about $7.5 billion a year on personal care products. Because African American women use more personal care products on average, they're likely to be exposed to a greater number of possible hazardous chemicals. In an analysis the EWG conducted on over 1,000 beauty and personal care products advertised and targeted to African American women, about 1 in 12 ranked highly hazardous on the EWG's Skin Deep Cosmetics database, which rates products from a 1, the lowest hazard, to a 10, the highest hazard. The safety of our personal care and cosmetic products is especially critical for women and girls because of the impact on their reproductive health and health throughout their lifespan. This amendment would ensure that the Office of Minority Health is consulted during the ingredient review process created by H.R. 5279, so we can provide meaningful protections to women and girls of color from ingredients linked to adverse health effects. For too long, weaknesses in our nation's cosmetic regulations have put the health of women and girls at risk. By including the Office of Minority Health in the ingredient review process, we're adding a critical safeguard for communities of color. I urge my colleagues to join me in supporting this amendment. Thank you, and I yield back.
Gentlewoman yields back. Are there any other members that wish to speak on the amendment? If there isn't any further debate, we'll proceed to a vote. All those in favor of the amendment will signify by saying aye. Aye. All those opposed? In the opinion of the chair, the ayes have it. The amendment is agreed to. Are there further amendments to the amendment in the nature of a substitute?
So now we go to the Republicans.
No one on the Republican side. On the Democratic side, the gentlewoman from Michigan, Ms. Dingell, is recognized.
Thank you, Madam Chair. My colleague, Congresswoman Custer, and I have an amendment at the desk.
The clerk will report the amendment, please.
Amendment to the amendment in the nature of a substitute to H.R. 5279, offered by Mrs. Dingell of Michigan and Ms. Custer of New Hampshire. Page 32 after line 24.
Clerk, without objection, the reading of the amendment will be dispensed with. And the gentlewoman is recognized for 5 minutes.
Madam Chair, we've heard a lot about the dangers of PFAS in this committee. I'm going to be unemotional today to my colleagues on the Republican side. But these are toxic forever chemicals that persist indefinitely in the environment. PFAS has been linked. We know this. We talk about it all the time, and I know my colleagues on both sides. I mean, this isn't a partisan issue. This has been linked to health diseases, kidney cancer, testicular cancer, thyroid disease, high cholesterol, and ulcerative colitis, just to name a few. With the passage of the Bipartisan PFAS Action Act, the Energy and Commerce Committee has taken strong action to address this issue. But it continues to be problems in a number of other areas, and we've got to look for ways to protect the American people, particularly those in cosmetic products. This straightforward amendment would require the FDA to prioritize review of PFAS ingredients in cosmetics and personal care products. It would expedite ingredient review of these chemicals by the FDA. We already know that these toxic forever chemicals are dangerous to human health, and they're in cosmetic products right now. This amendment would empower FDA to act on this knowledge and remove the threat of PFAS from cosmetics. I want to thank my friend and colleague, Congresswoman Custer, for her leadership and her work on this amendment and all of her work with me on PFAS, and I would now yield to her.
Thank you to my friend and colleague, Congresswoman Dingell, in offering this amendment for the FDA to prioritize PFAS as part of its ingredient review. I've been alarmed for some time about our lack of regulation in personal care products. And last December, I was pleased to have the opportunity to elevate this issue in our legislative hearing on cosmetics and personal care products. In that hearing, I mentioned a little-known ingredient I found in a cosmetic product, PTFE. PTFE is best known as Teflon, which many may recognize as a non-stick ingredient in our frying pans. Why this is the first listed ingredient in a cosmetic, I couldn't tell you. And it's not rare. It turns out PFAS is a fairly common ingredient in our cosmetics and personal care products. Waterproof mascara and eyeliner, eyeshadow, and foundation can all contain Teflon. This committee has been a leader on the issue of PFAS exposure, and what we've learned is that some PFAS chemicals are highly toxic at very low doses. I hope others share my concern that we're using products that contain PFAS on the largest organ in our body, our skin. It's scary to think about, but we do not know how this is impacting our health through dermatological exposure. And that's why I'm proud to offer this amendment with Congresswoman Dingell. I applaud her leadership, and I thank my colleagues on both sides of the aisle in joining us to ensure that we are keeping consumers safe from exposure to PFAS chemicals. And I yield back.
Does the gentlewoman from Michigan yield back?
Yes, I yield back to the remainder
Thank
of
the
our time.
gentlewoman, and I'd like to recognize Dr. Bouchon. Shimkus? Oh, I thought you had your hand up, Doctor.
We both did, I think.
You
I
both
didn't know
did.
either one. So, thank you, Madam Chairman. I rise to oppose the Dingell amendment. Mr. Chairman, my concern with the amendment is that FDA could be expending resources reviewing PFAS substances, of which there are 7,866, instead of reviewing ingredients that may pose greater risk to consumers. I have a couple of questions for council intended to clarify what the amendment language would do. So for council, what would the amendment language offered by Ms. Dingell require the secretary to do?
Under the amendment, the secretary would be required to prioritize these substances for review as the secretary deems appropriate based on two factors. The first being the frequency of use of those substances in cosmetic products or ingredients, and then the potential health concerns associated with those products or ingredients.
So if the secretary identifies a PFAS substance that is frequently used in cosmetic products and there may be a potential health concern with that substance, would the secretary have to prioritize its review?
It would be at the secretary's discretion, but the secretary, under this language, could prioritize that review.
There are several other ingredients that have been identified in conversations as ones that should be prioritized for review under this amendment. If the secretary identifies a PFAS substance that is frequently used in cosmetic products and could pose a potential health concern, would the FDA have to prioritize the review of that substance over the review of formaldehyde, even if formaldehyde poses a greater risk to human health?
Under the language of the amendment, it says that the secretary shall prioritize the review as deemed appropriate.
Shall or may?
It's a shall, but it would
So
be
what-
at
so
the
I'm not-
secretary's discretion.
So is it a shall or may?
So the secretary shall prioritize for review, but ultimately it is the secretary that identifies the ingredients that are subject to review.
So maybe a may versus a shall might be better? I would recommend. If the secretary identifies a PFAS substance that is frequently used in cosmetic products and could pose a potential health concern, would the FDA have to prioritize the review of that substance over the review of propylparaben, or even propylparaben pose a potential greater risk to human health?
Again, that would be subject to the secretary's discretion.
So I have about there are 4 or 5 major chemicals of major concern that we all agree upon. There are 7,866 permutations of PFAS, and we've gone over this, Ms. Dingell and I, the past year, having this debate. FDA approves PFAS medical devices as safe for insertion into children's hearts today. And you all have seen the schematic I brought to this debate. The concern is with this amendment that the secretary may, or actually shall may, however we want to legally parse that out, and then prioritize possible concerns to human health over real concerns over human health. there's only 29 of the PFAS chemicals that we can identify of the 7,866. So part of the debate we've had with the NDAA and then with our own bill is, let's get the universe that, one, we can identify and we know are dangerous. And make this make a little more sense and doable than just say a whole class of chemicals that the FDA has approved in medical devices, PFAS devices, insertion into children's hearts to fill the gap of a hole. And I hope that we can get some sanity in this debate on PFAS and regulate what we know is bad, and as other occurrences may come, then let's address those. But to ban an entire class of chemicals that are used in safety, health, in the community, in our defense sector, in our F-16s, is not helpful to solve the problem that you're trying to solve. And with that, I'll yield back my time.
Would the gentleman yield?
I would.
Thank you. And I thank you. You and I will probably be talking about this for decades. But the intention of this amendment is not to tie FDA, and we both really care. I mean, we both want to keep people safe. The intention of this amendment is not to tie FDA's hands. Rather, it's to empower them to address the presence of this toxic forever chemical in cosmetics and personal care products. As a reminder, we know these PFAS chemicals can be harmful to individuals. The need to, yes?
Madam Chair, if I'll just respond, we are politically putting our thumb on the scale when we do this legislatively.
The gentleman's time has expired. The chair recognizes the gentleman from New Jersey, Mr. Pallone, for 5 minutes.
Thank you, Madam Chair. I just wanted to say why I support the amendment by Ms. Dingell and Ms. Custer. It directs the FDA to prioritize for review PFAS or PFOA substances based on the frequency of the use of such substances in cosmetics and the potential health concerns associated. But this committee knows well the dangers of PFAS or PFOA. We've had legislation on this. Studies show the exposure is linked to several medical conditions. And while I hear the concerns of that Mr. Shimkus has raised, I do respectfully disagree. As drafted, the amendment still leaves decisions related to ingredient selection for purposes of review to FDA and gives FDA the discretion to prioritize PFAS or PFOA substances as the agency deems appropriate. So if FDA determines that another ingredient or substance poses more harm than PFAS or PFOA, FDA retains the ability, even under this amendment, to select another ingredient, well, I'm talking about under the AINS, right, to select another ingredient or substance for review over PFAS or PFOA, and FDA is not mandated to make PFOA or PFAS substances the first three ingredients for review. In fact, FDA would be permitted to review these substances as a category should the agency choose to. So I'm not talking about the AINS, I'm talking about Dingell-Custer's amendment to the AINS now. So I think that what Dingell and Custer have provided for, that there's enough flexibility for FDA to act as needed to ensure cosmetic ingredients of most harm are reviewed. But again, Mr. Shimkus, as always, we'll be happy to work with you to ensure that this intent is preserved as we go to full committee. So right now, I think that your concerns are met, but that doesn't mean that we can't continue to work as we go to full committee to try to address it better. So I would urge my colleagues to support the amendment and yield to you, to Ms. Dingell.
Thank you. I just want to go back to my colleague and say that the need to act is clear, but the intention of the amendment is to provide the FDA the authority to act on these substances without delay within the framework, but preserving the agency's discretion to respond appropriately to other potentially dangerous substances of concern in cosmetic products. So I understand your concerns. I support what the chair just said. We can continue to discuss these and work to address any unintended consequences of the provision as we're moving forward. And with that in mind, I would urge that we need to address PFAS chemicals in cosmetics, that it's serious, and I would urge my colleagues to support this amendment and that we would work to continue to address your concerns between subcommittee and full committee. Thank you, and I yield back.
Would the gentleman yield for a minute?
Yeah, of course, sure.
Just, again, I want to highlight, there are 7,866 permutations of PFAS, PFAS. When we talk about this, we talk about PFOS, PFOS, and we talk about PFOA, which we're all good with. But what about the other 7,864 permutations? I mean,
We can try to either refine.
we can only identify 29 in testing.
No, I understand. We're looking forward in different possibilities, but I think that the way the two gentlewomen have put this forth, that still can be
Would the
addressed.
gentleman yield?
Yeah.
I don't know this in the depth that several members of the committee do, but what I'm struck by is we know about 29 out of the 7,864. That's today. 66. Or 66, I'm sorry. But I think that whatever legislation is written has to look into the future. The ink shouldn't just reflect what's in place today. So moving forward, I mean, into the future, we have, I believe, there will be more and more revelations about this massive number, and I believe that the FDA then needs to do what needs to be done with those numbers. So no legislation shouldn't be static. It's not just a snapshot of today.
Well, Madam Chair,
Yeah, well, it's
if the chairman,
I'll yield to
back
the
Mr.
gentleman.
Pallone.
but the underlying bill allows that. The underlying bill allows the FDA to intervene on new chemicals.
So what's your problem?
My problem is prioritizing PFAS over more dangerous chemicals based upon the Secretary shall, may shall, however
You
want to.
don't buy that, the bill, the way it's written, the amendment, the way.
I think you're gonna raise a class of PFAS chemicals over formaldehyde.
Just because it's mentioned, even
And
though.
we know the authors of this, have we been working on this bill, there's a reason why I use these for chemicals.
Well, I understand.
Because
your
we know they're
concern. I
bad.
think that right now, the amendment still allows other things to be considered and prioritized, but, we'll certainly look at it. I mean, I'm not disagreeing. Mr. Bouchon, I don't know if he wants my 8 minutes or his own time.
My own time.
He wants his own time.
Exactly. I yield back.
The gentleman yields back. The chair recognizes Dr. Bouchon for his 5 minutes.
I move to strike the last word. Ms. Custer mentioned a specific compound, which is the first time in this debate I've heard it specifically mentioned, PTFE, which is polytetrafluoroethylene, which is not only used in pans, but it is the compound that's used in vascular grafts and vascular patches. It's also Gore-Tex, that's the other trade name for this, which is used in ski jackets, gloves, anything that needs to be waterproof. But I want to speak to the vascular graft and patch situation. This has been reviewed by the FDA, shown to be safe, and these have been implanted in various forms of vascular grafts, and as Mr. Shimkus pointed out, atrial septal defect repairs in young children in millions and millions of patients for decades. And so I want to associate myself with his words. I mean, I think if you broadly do this type of thing without looking at specific compounds like PTFE, polytetrafluoroethylene, Gore-Tex, Teflon, you're gonna ban vascular grafts and vascular patches for future millions and millions of patients that we've found that this is the best compound, and for a couple of reasons. Number one, it's very slick. The blood goes through it, and blood doesn't clot on the surface of this very well. So it's been shown to be the best substance. There are some alternatives not as good. So my concern with any legislation like PFAS legislation or this amendment is where it puts the FDA, to prioritize this is that we potentially are going to make it difficult for the medical industry to create new devices or use devices that have been used for decades in millions of patients. We're going to outlaw them, basically. We're going to make them illegal. And the other thing is you're going to open this up. You're going to open up any patient that's had this put in them, and I can see the TV ad right now. If you've had a vascular graft that included PTFE, call 1-800 whatever. And you will have, it just creates a litigation nightmare for unnecessary purposes because these devices, these have been shown to be safe in patients for decades by the FDA. And that's my concern. I mean, from a medical standpoint, I used to put these grafts in patients for years. And that's why, without defining, the specific types of PFAS that we know about and we know to be harmful, and more broadly, trying to address thousands of these, you can put yourself in a tough spot. And so that's my main concern. I hadn't heard PTFE specifically mentioned, but now it's specifically mentioned saying it's bad because it's exposing people to this. And I would argue that there's no proof that that's true. And I would also argue that it's already been proven to be safe by the FDA. So I'd be very cautious. With that, I yield back.
I was going to ask the gentleman if he would yield.
Yes, ma'am.
I just want to make a point that there are only 14 PFAS in cosmetics, and that this bill only applies to cosmetics. So I just am begging you all to think about your daughters, your wives who are using these. And I'm not saying mandate, we're not saying it, none of us are saying mandate it. Let's give the FDA commissioner authority. Thank you. Yield back. May I?
Anybody on the Republican side want a minute? I yield back.
The gentleman yields back. Is there anyone on our side? The chair recognizes the gentlewoman from New Hampshire, Ms. Custer.
Thank you very much. I just wanted to point out that this is why we have confidence in the FDA having this discretion and making this decision. What I'm dealing with in New Hampshire is clusters of pediatric cancers based upon PFAS chemicals. And this is simply with regard to cosmetics that women throughout the United States Congress, throughout this country, in our families, use on a daily basis, on our eyes, on our face, and just in terms of what is safe. This should not be left off the table for consideration. We're not referring to the issue that you've brought up, and I think that's been very clear in our amendment. So thank you. I yield back.
The gentlewoman yields back. Is there anyone on the Republican side that would like to speak to the amendment? Seeing none on our side. None. If there's no further debate, we'll proceed to a vote on the amendment. All those in favor of the amendment will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. The amendment is agreed to. Are there further amendments to the amendment in the nature of a substitute?
Chairman, I have a Chairman issue.
On the Ms. Dingle is recognized.
I have an amendment at the desk.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 52.
Without objection, the reading of this amendment will be dispensed with.
Thank you, Madam Chair. I would like to thank Chairman Pallone and the committee for their hard work on this cosmetics reform legislation, which brings much-needed reform and modernization to the current FDA authority and it will help protect public health and safety. One issue that we should address moving forward, however, is the presence of asbestos, recognized by FDA as a known carcinogen in cosmetic products made with talc. Our children are buying makeup and using it that has asbestos in it. Experts have found more than 1,000 loose and pressed powders made with talc that are currently on the shelves or available over the internet. Just this week, the FDA commissioned laboratory tests that found asbestos in 9 out of 52 popular cosmetic products that were tested. These include baby powders and facial powders. Few of these products alert consumers to the risk that talc can be contaminated with asbestos. So people are using products that have asbestos in it. And we know what asbestos does to the body. This amendment's simple. Companies must utilize the modern testing methods recommended by the FDA's Interagency Working Group on products containing talc that are intended for children. If they do not, they must place a warning label alerting consumers that talc in a cosmetic product has not been evaluated for asbestos contamination and that asbestos may be present. This common sense amendment merely requires that cosmetics and personal care product manufacturers show their work here. However, I love my Republican friends, and I want to work with you. And understanding that my colleagues need time to weigh in and further examine this approach, I will withdraw this amendment. But this isn't a partisan issue. Ensuring that our kids are using safe makeup is something we all care about. I look forward to continuing this work between subcommittee and full committee.
Gentlewoman yields back.
I do.
She withdrew the amendment.
Pardon me?
She withdrew the amendment.
And she withdraws her amendment. Are there any other members seeking recognition to offer an amendment? Seeing none, no further discussion on or amendments, will proceed to a vote on the amendment in the nature of a substitute. All those in favor of the amendment in the nature of a substitute to H.R. 5279, and has it been amended? Yes. As amended, will signify by saying aye. Aye. All those opposed signify by saying no. No? Those are little weak no's there. In the opinion of the chair, the ayes have it. The amendment in the nature of a substitute to H.R. 5279 as amended is agreed to. The question now occurs on forwarding 5279 as amended to the full committee. All those in favor of forwarding H.R. 5279 as amended to the full committee will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. The ayes have it, and 5279 as amended is forwarded to the full committee. We will now take up, the chair now calls up H.R. 5668, the Modern Labeling Act of 2020. The clerk will report the title of the bill.
H.R. 5668, a bill to amend the Federal Food, Drug, and Cosmetic Act to modernize the labeling of
Without
certain
objection, the
generic...
first reading of the bill will be dispensed with. The bill is now considered as read. I'll now recognize Ms. Matsui to offer a manager's amendment, and the clerk will report the amendment.
Amendment to H.R. 5668 offered by Ms. Matsui. Page 2, line 17 through page 3.
Without objection, the reading of the amendment will be dispensed with. I now recognize the gentlewoman from California for her 5 minutes to speak in support of the amendment.
Thank you very much, Madam Chair. Recognizing concerns from stakeholders, I have been working in a bipartisan way with my co-lead, Representative Brett Guthrie. the Chairman's office, and other members of our committee to ensure that we continue to protect patients while creating a pathway to modernize generic drug labels. This amendment includes a new provision to clarify that the process created under this bill to update labels for new conditions of use cannot be used as an alternative pathway to initiate safety labeling changes. Safety changes must continue to go through FDA's existing safety pathway. We are making progress, and I look forward to continuing our conversations with stakeholders on improving this bill as we move to full committee markup. Prescription drug labels are the most readily available and trusted sources of drug information, and I'm significantly concerned that current law limits modernizing many older treatment labels to reflect the latest clinical evidence. The Modern Labeling Act will make sure that Americans have access to reliable, high-quality sources of information to help make the right healthcare decisions. I encourage my colleagues to support this bipartisan bill to strengthen the role labels play in informing treatment decisions, safeguard our public health, and facilitate greater use of lower-cost generics. With that, I yield to my colleague, Mr. Guthrie.
Thank you. I thank the gentlelady for yielding. And Madam Chair, I accept this amendment, urging my colleagues to do the same. Congresswoman Matsui and her staff, committee staff, and my staff have been working hard to ensure that labels of generic drugs with no brand can be updated to help patients receive the best possible care. I'm glad we have been able to work in a bipartisan way on this bill and look forward to this bill going forward to the full committee. And I yield back to my friend from California.
I yield.
Will the gentlewoman yield this?
Yeah, I yield to the chairman.
Thank you. I just wanted to say something about the AINS, or the manager's amendment. It's important to note that brand and generic manufacturers have the responsibility to work with the FDA to update drug safety information, and that doesn't change under this bill. The amendment offered by the gentlewoman ensures that when a manufacturer needs to update a label solely with new safety information, manufacturers and FDA must pursue the current process available under the law today. And drug safety is paramount, and we want patients to have certainty that they'll have up-to-date safety information. I know that some stakeholders have raised concerns about the scope of label changes that could be made under the modern framework in this bill. And it's my intent that the modern framework shall be used by FDA to prioritize labeling changes related to new uses, but should not be hamstrung in their ability to make label changes as needed. So we're going to continue to work to find the balance as we move to the full committee on this. And we had a witness from Friends of Cancer Research who said at our hearing, and I quote, that preserving the accuracy and reliability of labeling may be viewed as tantamount to preserving trust in and the relevance of the drug approval system, unquote. And I think this bill helps preserve that trust and urge all members to support it. And yield back to the gentlewoman.
Gentlewoman yield for a moment. I want to thank Ms. Matsui and Mr. Guthrie for their excellent work. The one thing that I'd like to add to this is that 90% of the drugs that the American people take are generics. So this is, it may seem like a small bill in terms of the length of it, but it really packs punch for that 90% of the American people and the generic drugs that they take. So the gentlewoman yields back. Is there anyone else that would like to speak to the amendment on either side? Seeing none, no further debate. We'll proceed to a vote on the amendment. All those in favor of the amendment will signify by saying aye. Aye. Those opposed signify by saying no. In the opinion of the chair, the ayes have it. The amendment is agreed to. Are there further amendments to the legislation? The question now occurs on favorably forwarding 5668 to the full committee. All those in favor of forwarding H.R. 5668 to the full committee will signify by saying aye. Aye. All those opposed will signify by saying no. Hearing none, in the opinion of the chair, the ayes have it. H.R. 5668 is forwarded to the full committee. Bravo to the authors. That's terrific. The chair now calls up H.R. 5663, the Safeguarding Therapeutics Act, and the clerk will report the title of the bill, please.
H.R. 5663, a bill to amend the Federal Food, Drug, and Cosmetic Act to give authority to the Secretary of Health and
Without
Human
objection,
Services.
the first reading of the bill will be dispensed with. The bill is now considered as read. Without objection, the bill is considered as read and open for any amendment, for amendments at any point. Are there any members seeking recognition to offer a bipartisan amendment? Pardon me?
Does anyone want to speak on the bill?
No. Does anyone wish to speak on the bill?
Yes, I'd like to speak on the underlying bill.
I think we need to go to our Republican colleagues. The chair were you seeking recognition?
I was seeking recognition, yes, ma'am.
The gentleman is recognized.
Thank you, and I appreciate sharing the time with my friend from New York. We worked on this together. This came from my tour and our tour. I think you've toured as well. My tour of JFK Airport. And what we found were there were products that the FDA has the authority to destroy counterfeit drugs, but not counterfeit medical devices. So if the drugs were packaged or contained or within a counterfeit medical device, we had agents say that they had to return to the return address, send back, and sometimes they saw it come back exactly as they returned it into the country. So this bill would give authority for them to destroy illicit medical devices, which includes combination products, and it'll strengthen our supply chain. This bill will improve the ability of the federal government to curtail the supply of counterfeit medical products in the United States. I really appreciate my friend from New York, Congressman Engel, for working on this bill with me, and I can yield him the rest of my time or yield back. And I yield back. If he'd like my time, he's welcome.
I'll take your time.
You're welcome.
Yes, thank you. Thank you, Chairwoman Eshoo and Chairman Pallone, for holding today's markup, including my bipartisan bill with Congressman Brett Guthrie, and I want to thank the gentleman for working on this bill with me. This bill is called the Safeguarding Therapeutics Act, and it provides the FDA with another tool to protect the American public by allowing the agency to destroy counterfeit medical devices. Now, counterfeit medical devices are a growing public health threat. And let me give you an example. Just this past February, the FDA, in concert with the Indian government, stopped a batch of illicit medical products, which included counterfeit combination medical devices destined for the United States market. With the growing coronavirus outbreak, including more than 100 cases in Westchester County, which I represent, we can expect that criminals will try to make a quick buck by selling fake treatments and medicines to concerned Americans. I urge my colleagues on both sides of the aisle to pass this common sense bipartisan legislation and protect Americans from dangerous medical products. I want to again thank my friend, the Congressman Guthrie, for working on this with me. And Chairwoman Eshoo, I ask for unanimous consent to submit into the record a letter of support from the Health Industry Distributors Association in support of our bill, H.R. 5663.
Without objection, so ordered.
Thank you. I again urge my colleagues on both sides of the aisle to pass this legislation. I yield back the rest of my time.
The gentleman yields back. Bravo to the two authors of this legislation. The question now occurs on favorably forwarding H.R. 5663 to the full committee. All those in favor of forwarding H.R. 5663 to the full committee will signify by saying aye.
Aye.
All those opposed will signify by saying no. The opinion of the chair, the ayes have it. H.R. 5663 is now forwarded to the full committee. The chair calls up H.R. 4712, the Fairness in Orphan Drug Exclusivity Act, and the clerk will report the bill. The title of the bill, please.
H.R. 4866, a bill to amend the 21st century. Oh, I'm sorry. I apologize.
4712.
This is the one that you're offering.
H.R. 4712, a bill to amend the Federal Food, Drug, and Cosmetic Act with respect to limitations on exclusive approval or license
Without
of
objection,
orphan
the
drugs.
first reading of the bill will be dispensed with. The bill is now considered read. And open for amendment at any point. Are there, I'm now going to recognize myself to offer a manager's amendment, and the clerk will report the amendment, please.
Amendment to H.R. 4712, offered by Ms. Eshoo. Page 2, line 17, strike 1. Page 3,
Without
line
objection,
2.
the reading of the amendment will be dispensed with, and I now recognize myself for 5 minutes to speak in support of the amendment. The Fairness in Orphan Drug Exclusivity Act was introduced by Representatives Madeline Dean, Congressman Mark Vesey, our own famous pharmacist, the gentleman from Georgia, Mr. Carter, and David McKinley from West Virginia. The bill closes a loophole so that orphan drug exclusivity cannot be used to deny access to certain drugs, especially drugs for opioid use disorder. The amendment I'm offering today incorporates technical feedback from the FDA. It's a narrow bill to fix a technical problem without hurting the original intention of the Orphan Drug Act by requiring drugs to show that they will not recoup costs each year in order to achieve the orphan drug designation. So I urge my colleagues to support this legislation. Are there other members seeking recognition to speak on the amendment? The chair recognizes the ranking member to speak to it.
I thank the chair. I wish to strike the last word.
So ordered.
So I appreciate the sponsors, including our friend Mr. Carter, for introducing this bill. H.R. 4712 closes an important loophole in the Orphan Drug Act. This has allowed drug companies to benefit from an orphan drug designation awarded based on a demonstration that they could not recover the cost of drug development. This designation and the possibility of receiving orphan drug exclusivity remains even if the company goes on to make substantial amounts of money and profit from that drug. Further, the language would apply retroactively and allow the Food and Drug Administration to revoke a product's exclusivity awarded before enactment unless the manufacturer could demonstrate that there was an inability to recoup the drug's development costs at the time of approval. While there is no known product currently on the market that has an orphan drug designation under this cost recovery mechanism and that benefits from exclusivity, I do think we should be cautious when putting forth policies that set a precedent of revoking a benefit awarded prior to enactment of the legislation. Should this precedent be applied elsewhere in statute, it could have a chilling effect on innovation. We would not want to discourage a truly innovative drug in development by instilling uncertainty in the market. That said, I'm glad we're fixing a loophole in the Orphan Drug Act today, and we're happy to yield to anyone else or yield back my time.
The gentleman yield.
I'll be happy to yield.
Madam Chair, thank you for the time today to let me speak on this important legislation, and I thank Congresswoman Dean for introducing it. I'm glad to be a lead Republican on this bill as it corrects a loophole in the Orphan Drug Act that has been and will be taken advantage of at the expense of consumers' health. As y'all know, the Orphan Drug Act provides exclusivity incentives for sponsors to produce drugs that treat illnesses wherein the drug may not become profitable or that treat a small portion of the population. Unfortunately, a loophole exists that allows some drugs to obtain exclusivity even though they expect to easily recoup their R&D costs and turn a profit. This exact problem took place in just the past few years when the drug treating opioid abuse disorders got FDA approval, orphan status, and a new 7-year exclusivity period, despite the active monitor remaining the same, all based on the drug's original 1994 orphan designation. This subsequently temporarily blocked a new opioid abuse drug from coming to market. We all know how important it is to the American people that we reduce the price of drugs, and this is a great bipartisan start. The Orphan Drug Fairness Act would stop the ability for some drugs to obtain exclusivity, in turn allowing more competition and innovation in the marketplace, benefiting consumers' health and lowering cost. I would urge you to vote for this legislation, and I thank you again for your time, and I yield back.
I yield back.
The gentleman yields back. Are there other members seeking recognition to speak to the is it an amendment? The chair recognizes the gentlewoman from New Hampshire, Ms. Custer, for 5 minutes.
Thank you, Madam Chair, and I move to strike the last word, and I just want to say I join my friend and colleague, Representative Carter from Georgia, just to give you a sense of the scope of this opioid situation. I'm pleased to see the committee bringing up the Orphan Drug Act as part of our work today. This issue has had dire implications in access to treatment for opioid use disorder, which we are all too familiar with in my home state of New Hampshire. Addiction is not a rare disease. It is in every one of our communities. Without this legislation, companies would be able to game the system, monopolize the market, and limit access to life-saving medication for substance use disorder. If we are going to overcome this opioid epidemic, we must use all the tools at our disposal. Medication-assisted treatment is a critical component in our fight to end the opioid epidemic. Without this legislation, companies, as Representative Carter indicated, would be able to game the system, monopolize the market, and limit access to life-saving medication for substance use disorder. We've heard about how the abuse of the orphan drug status has allowed companies to prevent new formulations of medication-assisted treatment from entering the market for their own financial benefit during this crisis. The Orphan Drug Act closes this loophole so that Granite Staters and folks around this country battling opioid use disorder will have access to medication-assisted treatment at a more affordable cost. I want to thank my colleague, Congresswoman Madeleine Dean, for this important legislation. I encourage my colleagues to support the Orphan Drug Act, and I yield back. Thank you.
The gentlewoman yields back. Are there other members seeking recognition to speak on this amendment? Seeing none, and there is no further debate, we'll proceed to have a vote on the amendment. All those in favor of the amendment will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. The amendment is agreed to. Are there further amendments to this legislation? The question now occurs on favorably forwarding H.R. 4712 to the full committee. All those in favor of forwarding H.R. 4712 to the full committee will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. H.R. 4712 is forwarded to, as amended, is forwarded to the full committee. Okay, moving along. The chair now calls up H.R. 2117, the FASTER of 2019, the FASTER Act of 2019. The clerk will report the title of the bill.
H.R. 2117, a bill to improve the health and safety of Americans living with food allergies
Without
and
objection,
related
the
disorders.
first reading of the bill will be dispensed with. The bill is now considered read. Without objection, the bill is considered as read and open for amendment at any point.
Madam Chair.
I now recognize the gentlewoman from California to offer an amendment in the nature of a substitute, and the clerk will please report the amendment.
Amendment in the nature of a substitute to H.R. 2117,
Without
offered by
objection, the
Ms.
reading of the
Matsui.
amendment will be dispensed with, and Ms. Matsui is recognized for 5 minutes.
Thank you, Madam Chair. For the 32 million Americans with food allergies, including 1 out of every 13 children, having major food allergen information on ingredient labels empowers individuals and their families to take necessary precautions against accidental exposure to a known food allergy. The FASTER Act updates allergen labeling laws to include protections for those allergic to sesame. It also requires updated labeling for new allergens as scientific evidence emerges, creating a more proactive pathway to ensuring safe and accurate labels on packaged food products. The amendment incorporates technical feedback from HHS, FDA, and CDC that will allow the bill to be implemented in a way that best achieves our policy goals to improve safety and collect more food allergy patient data. Importantly, the FASTER Act lays the critical groundwork for conducting the research necessary to find new treatments. By improving the ways in which we monitor and manage these complex and multifaceted diseases, we can better understand and eventually find a cure for food allergies. I urge my colleagues to support this amendment and the underlying bill. Thank you, and I yield back.
The gentlewoman leads back. Are there other members seeking recognition to speak on the amendment? Seeing none, the clerk, are there any members who seek recognition to offer an amendment to the amendment in the nature of a substitute? If there's no further debate or discussion or amendments, we'll proceed to a vote on the amendment in the nature of a substitute. All those in favor of the amendment in the nature of a substitute to H.R. 2117 will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. The amendment in the nature of a substitute to H.R. 2117 is agreed to. Bravo. Okay. The next one. Got it. Okay, the question now occurs on forwarding 2468 is amended to the full committee. All those in favor of forwarding H.R. 2468 is amended to the full committee will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. H.R. 2468 is
Madam
amended.
Chairman,
Yes.
the clerk's trying to get someone's attention. The council?
The bill that we're currently on is 4866, or, I'm sorry, 2117.
Oh, are you, we put the wrong number in. We put the wrong number in. So let me restate that the question, let's redo this. The question now occurs on forwarding 2117 as amended to the full committee. All those in favor of forwarding 2117 as amended to the full committee will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. 2117 is amended, is now forwarded to the full committee. All right. Perfect, we are not. The mark of humanity. The chair calls up H.R. 2468, the School-Based Allergies and Asthma Management Program Act, and the clerk will report the title of the bill, please.
H.R. 2468, a bill to amend the Public Health Service Act to increase the preference given in awarding certain allergies and
Without objection,
asthma-related
first
grants.
reading of the bill will be dispensed with. The bill is now considered as read. I'm not going to, well, I am. I'm going to recognize myself to strike the last word and speak on the underlying bill for 5 minutes. Not that one? All right. Recognizing myself to offer a manager's amendment.
It's an AIDS.
It's an AINS?
It's an AIDS, isn't it?
Well, you need to give me clear information here.
It's a manager's.
It is a manager's amendment. The School-Based Allergies and Asthma Management Program Act was introduced by Representatives Hoyer and Rowe. 1 in 13 children have asthma. Oh, the clerk has to report it? All right. Would the clerk please report the manager's amendment?
Yes, ma'am. Amendment in the nature of a substitute to H.R. 2468, offered by Ms. Eshoo. Strike all after the act.
Without
and
objection,
insert
the
following.
reading of the amendment is dispensed with. And I recognize myself to offer the manager's amendment. Well, I just mentioned the two members, Hoyer and Rowe, that have introduced this bill, and it's an important one. 1 in 13 children in our country have asthma, and 1 in 13 have food allergies, meaning that every school in our country is likely to have children with these conditions. And children with asthma miss far more school than those that don't have it. Asthma disproportionately affects children from low-income families. And poor children are more likely to have asthma, less likely to be able to manage symptoms, and more likely to be admitted to the hospital due to an uncontrolled episode. Asthma remains far more common among Black and Hispanic children, 14% and 8% respectively, than among white children. They are reported at 5.6%. And only 27 states require schools to have emergency protocols for asthma, and only 36 states require emergency protocols for anaphylaxis. This legislation will help fill the gaps in state requirements related to emergency protocols, indoor air quality, and other preparedness factors by making grant money be preferentially awarded to states that meet these requirements. So my amendment makes a few technical changes to improve the legislation's implementation, and I urge my colleagues to help these children. They deserve our help, and so do their schools, by supporting this bill. Are there other members that wish to speak on the issue? Mr. Shimkus, you're recognized.
Thank you, Madam Chairman, and I think I'll ask time to speak on the amendment. But I want to make a brief observation about this bill. I think it is great that we're moving forward with H.R. 2468, a bipartisan bill that would make it easier for states to receive grant funding for those of their schools that have school-based asthma and allergy program that identifies students with issues, requires those students to have an action plan, and has trained personnel on site to educate and coordinate efforts to reduce environmental triggers and support student care. This bill is especially timely since we're entering into spring, with pollen sure to activate people's allergies and induce asthma responses in those most susceptible. What concerns me, though, is that our good intentions and work here might be undone tomorrow by the Environment and Climate Change Committee. Specifically, that subcommittee, in which I am the Republican leader, is marking up H.R. 5544, legislation to phase down hydrofluorocarbons consistent with an amendment to the Montreal Protocol. Many people think that H.R. 5544 is only about air conditioning equipment and chemicals, but the Montreal Protocol is about much more than that. As a Republican leader on this subcommittee, Dr. Burgess knows all too well the Montreal Protocol profoundly impacted asthma and inhaler availability and prices about a decade ago. The alternative to those banned chlorofluorocarbons in metered dose inhalers were hydrofluoralkylanes. Currently, 15 treatments to pulmonary conditions that range from wheezing to asthma to COPD are treated with HFA, hydrofluoralkanes inhalers. These hydrofluoralkane inhalers are essential to these drugs, though, are also considered HFCs. And I hope my the chairman of the sub and really the chairman of the full committee hears this, that the HFSAs of these inhalers are HFCs that we plan to ban tomorrow in a markup tomorrow, and will be statutorily phased down. Moreover, the bill we will mark up tomorrow doesn't permit essential use exemptions until 2034. If saving people choking to death from asthma isn't an essential use that should be granted on date of enactment, I'm not sure what is. I hope as both bills are considered by the committee that we can coordinate the policy so we're not trying to promote public health by taking away the tools for it. And with that, Madam Chairman, I would yield to Dr. Burgess.
This is an important point, having lived through this problem in 2013. The practical effect of banning CFCs and metered dose administrators and switching them over to HFAs, we got into a bureaucratic cul-de-sac where the EPA said it's banned under the Montreal Protocol, you can't sell them. The FDA said we'll have to approve with a new drug application these new metered doses that use HFA as the propellant and not CFCs. As a practical matter, as someone who has relied on over-the-counter epinephrine inhalers for decades, these were withdrawn from the market. I did buy every one that I could reasonably purchase on New Year's Eve of 2012, but my supply eventually ran out, and of course the product it contained does not last forever. So this is an important observation the gentleman was brought. I'm grateful that he's brought the observation. We do need to be careful about the unintended consequences, because I, for one, do not want to go back into that administrative cul-de-sac and have to wait another 6 to 8 years to have an over-the-counter asthma inhaler available. And I thank the gentleman for bringing this up, and I'll yield back.
I thank the chairman. So let me just briefly say, so what we're doing today is to help people with asthma. What we can do tomorrow can hurt people that have asthma if we're not careful. And that's kind of the cautionary note I would like to send as we mark up in the environment subcommittee tomorrow. With that, I will yield back my time.
The gentleman yields back. Is there any further debate on this? All right, then we will proceed to a vote on the amendment. All those in favor of the amendment will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. The amendment is agreed to. Are there further amendments to the amendment in the nature of a substitute? The question now occurs on forwarding H.R. 2468, as amended to the full committee. All those in favor of forwarding it will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. H.R. 2468, as amended, is forwarded to the full committee. The chair calls up H.R. 4866, the National Centers of Excellence in Continuous Pharmaceutical Manufacturing Act of 2019, and the clerk will report the title of the bill.
H.R. 4866, a bill to amend the 21st Century Cure Act to provide for designation of institutions of higher education.
The first reading of the bill will be dispensed with, and the bill is now considered as read. Without objection, the bill is considered as read and open for amendment at any point. I now recognize Mr. Pallone to offer a manager's amendment, and the clerk will report the amendment. Please.
Amendment to H.R. 4866 offered by Mr. Pallone. Page 2, line 12, strike. 180 days.
Without objection, the reading of the amendment will be dispensed with. I now will recognize Mr. Pallone for 5 minutes to speak in support of the amendment.
Thank you, Chairwoman Eshoo. I'm pleased that today we're considering a bill that will help to advance continuous manufacturing here in the U.S. The ongoing coronavirus outbreak has reiterated the need for the U.S. to take steps to help reduce our reliance on foreign manufacturing. As we heard from Dr. Woodcock last fall, Advanced manufacturing technologies such as continuous manufacturing can help to reduce the nation's dependence on foreign sources of APIs, increase the resilience of our domestic manufacturing base, and reduce quality issues that trigger drug shortages or recalls. This bill helps to invest in continuous manufacturing by directing FDA to designate academic institutions and other nonprofit organizations with expertise in this area to help advance continuous manufacturing technology and standardization, develop a continuous manufacturing workforce here in the U.S., and to make recommendations for how the FDA, industry, and others can expand the use of continuous manufacturing of drugs and biologics. And I believe these centers will be critical to helping industry and FDA better understand this technology and to encourage greater adoption of the use of continuous manufacturing that will help to bring manufacturing jobs back to the United States. The manager's amendment incorporates technical assistance and feedback from stakeholders to clarify the intent of the bill. I want to thank my colleague, Representative Guthrie, for his support and for working with me on this bill and the amendment. And I look forward, Madam Chair, to continuing to work with stakeholders as we move forward. I urge my colleagues to support this amendment, and I yield back,
The
Madam
chair yield? Will the
Yeah, I yield
chairman-
to the
chairman
gentleman,
yield?
sure.
Thank you, Mr. Chairman. I appreciate and working with you as well. And Madam Chair, I'd like to speak in support of the amendment. I do want to thank Chairman Pallone for working on this important issue with me and allow me to be part of working on this. And during the hearing on HR 4866, we learned how continuous manufacture could help with drug shortages that we now face. We talked about that in the drug shortage we face in the future, and we're at that point where there are issues as we're dealing with the coronavirus. I believe this bill is crucial in order to ensure Americans have access to medicine they may need when they need them, and urge my colleagues to support this bill. I appreciate all the working together, and I will yield back to the chairman.
Gentleman yields back. I recognize myself to strike the last word. And I want to thank Mr. Pallone and Mr. Guthrie for coming together to do this. The bill very importantly authorizes $80 million to be appropriated from 2021 to 2025. I think that on this issue of continuous manufacturing, it is an emerging technology. And it's important that we have technologies that emerge in this area. Why? Because the overwhelming number of the drugs that the American people take, and they are generics, are manufactured outside the country. We need to bring that manufacturing back to the United States. The United States should not be dependent on a foreign country for its drug supply. And there are many things that are attached to that drug supply chain that are deeply troubling for the people of our country. We've learned we have subpar manufacturing, we have tainted drugs, and drug shortages. And all of those are linked together. So in my view, the hope for the future of this, and we received really key testimony on this in our hearing, in more than one hearing, that continuous manufacturing is the pathway to the future of bringing drug manufacturing back to the United States. And through this, the Centers of Excellence in Continuous Pharmaceutical Manufacturing will organize the industry efforts to develop continuous manufacturing technology. So I say bravo to my colleagues for this. We still have a lot of work to do on the issue of our nation's drug supply chain. This is a very important step in it. And I want to again offer my gratitude to you for drawing this up, bringing it forward, and its passage today. Now, is there anyone else that would like to speak on 4866? No further debate. We'll proceed to a vote on the amendment. All those in favor of the amendment will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. The amendment is agreed to. Are there further amendments to the legislation? Hearing none, the question now occurs on favorably forwarding H.R. 4866 to the full committee. All those in favor of forwarding H.R. 4866 to the full committee will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. H.R. 4866 is forwarded to the full, as amended, is forwarded to the full committee. Okay, onward, as Churchill said. 2271. The chair calls up H.R. 2271, the Scarlet Sunshine on Sudden Unexpected Death Act. The clerk will please report the title of the bill.
H.R. 2271, a bill to amend the Public Health Service Act to improve the health of children and help better
Without
understand
objection,
and
the first reading of the bill will be dispensed with. The bill is now considered as read. Without objection, the bill is considered as read and open for amendment at any time. I will now recognize Ms. Blunt-Rochester to offer an amendment in the nature of a substitute, and the clerk will report the amendment, please.
Amendment in the nature of a substitute to H.R. 2271 offered by Ms. Blunt-Rochester. Strike all
Without
after the
objection,
enacting
the
clause.
reading of the amendment will be dispensed with, and Ms. Blunt-Rochester is recognized for 5 minutes.
Thank you, Madam Chair. This amendment in the nature of a substitute makes technical changes based on feedback from the Department of Health and Human Services. It also makes bipartisan conforming changes to better align this text with our Senate partners. As a co-sponsor of this legislation, I want to again reiterate this body's commitment to family support services. Families who have lost a child because of sudden unexpected infant death or sudden unexpected death in childhood should have access to support services during their time of profound loss. I am hopeful that when this bill moves to the Senate, they will also agree. And while I understand that no amount of funding will heal the grief of families who have lost a child to SUID or SUDC, I believe this authorization level represents a strong commitment from Congress. I'm also hopeful that the Senate will act in turn by authorizing these programs at higher levels. I'd like to thank my friend and colleague, Congresswoman Gwen Moore, for introducing this legislation and encourage my colleagues to join me in supporting this amendment and the bill's passage. Thank you, and I yield back.
Gentlewoman yields back, and we all thank not only you, but Congresswoman Gwen Moore. Are there other members seeking recognition to speak on the amendment? Pardon me?
I think Ms. Custer, I don't see any Republicans.
Is there anyone that would like to speak to the amendment? Seeing none, did you raise your hand? The gentlewoman from New Hampshire is recognized for 5 minutes.
Thank you. I'd like to strike the last word. Today, I'm here again on behalf of my great-niece, Leah, who passed from SIDS a little over a year ago. As her mother has said, our family will never be the same. Leah is with me in my heart and in the work we do here every single day. No one can imagine the pain that parents go through, and grandparents as well, when a child passes away unexpectedly and oftentimes unexplained. In this committee, we've heard testimony about sudden unexplained infant death and sudden unexplained death in children, and the numbers are startling. Families can follow the guidelines, take every precaution, and yet there are many still grieving their unexplained losses. While we have had tremendous success in bringing down the number for SIDS through education campaigns, there remain unexpected, unexplained deaths that demand more attention, more research, more education, and more support for families. The legislation before us today, the Scarlet Sunshine on Unexpected Death Act, is a comprehensive approach to improving national guidelines and data consistency for sudden infant death and sudden unexpected death for children. It also offers support for the families who are grieving their loss and supports evidence-based approaches for outreach to decrease risk factors. I'm proud to co-sponsor the bill, and I'm proud of my great niece Leah for her continuing advocacy. Thank you, and I yield back.
The gentlewoman yields back. Are there any members who seek recognition to offer an amendment to the amendment in the nature of a substitute? Seeing none or hearing none, if there's no further discussion, we will vote on the amendment in the nature of a substitute. All those in favor of the amendment in the nature of a substitute to H.R. 2271 as amended, no, it's not amended, will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. The amendment in the nature of the substitute to H.R. 2271 is agreed to. The chair would just like to make a quick announcement. We believe that votes will take place between 1 and 1:15. Let's finish up, and I have every confidence that we will. The question now occurs on forwarding 2271 is amended to the full committee. All those in favor of forwarding 2271 is amended to the full committee will signify by saying aye. Aye. All those opposed by saying no. In the opinion of the chair, the ayes have it. H.R. 2271 is amended and is forwarded to the full committee. It's a wonderful bill. We have a lot of great bills today. The chair calls up 4801, the Healthy Start Reauthorization Act of 2019. The clerk will please report the title of the bill.
H.R. 4801, a bill to amend the Public Health Service Act to reauthorize the Healthy Start program.
Without objection, the first reading of the bill will be dispensed with. The bill is now considered as read. Without objection, the bill is considered as read and open for amendment at any point. Are there any members seeking recognition to offer a bipartisan amendment? Without well, let's see. Hearing none, the question now occurs on favorably forwarding 4801 to the full committee. All those in favor of forwarding 4801 to the full committee will signify by saying aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. H.R. 4801 is forwarded to the full committee. The chair now calls up H.R. 1379, the Ensuring Last Smiles Act. The clerk will report the title of the bill, please.
H.R. 1379, a bill to amend the Public Health Service Act, the Employee Retirement Income Security Act of 1974, and the...
Without objection, the first reading of the bill will be dispensed with. The bill is now considered as read without any objection. The bill is considered as read and open for any amendment. Are there any members seeking recognition to offer a bipartisan amendment? The chair recognizes the gentleman from Florida, Mr. Bilirakis, for 5 minutes.
Thank you, Madam Chair.
You have an amendment?
No, I do not.
Oh, you want to speak to?
I want to speak on the bill, yeah.
All right, so you're striking the last word.
Correct.
Okay.
Correct. Strike the last word.
You're recognized.
Thank you. The Ensuring Lasting Smiles Act is a critical step in ensuring that those with congenital craniofacial anomalies like ectodermal dysplasia obtain the coverage they need for medically necessary procedures to address their anomaly, which can, if left unaddressed, lead to adverse health outcomes and costly secondary treatment episodes. All 50 states have some version of congenital anomaly laws that require health insurance companies to medically necessary treatments from the moment of birth, including treatment of birth defects. The Ensuring Lasting Smiles Act bill defines congenital anomaly and specifies that congenital anomalies, including conditions related to the teeth, oral cavity, and associated structures. I would like to recognize the efforts of the many faithful advocates. Advocates like Aidan Abbott, a Wisconsin teen who inspired his U.S. Senator to write and name this bill. Kevin Kozar, a Virginia father who testified before our subcommittee regarding his son, Cannon. And the Rizzo family, who visited with me and my staff to share their experiences caring for their beautiful daughter, Pax, in Florida. While I understand that there's work to be done, it's not finished completely, as there have been concerns raised regarding scope and cost. I ask this committee to continue to work together to advance a solution that is not just passable in a single chamber, but is capable of becoming law this Congress. Thank you, Madam Chair, and I yield back.
The gentleman yields back. Are there other members that would like to speak on the bill? The chair recognizes the ranking member for 5 minutes.
Thank you, Madam Chair. I seek recognition to engage in a colloquy with the chairman of the full committee on behalf of Mr. Walden, the ranking member.
So ordered.
So Mr. Chairman, on behalf of the ranking member, the understanding is that you're willing to work with us to make certain that we protect patients who have been adversely affected by coverage denials and make certain that they get the care that they need, but also not opening the door to mandating cosmetic procedures. Again, we share the goal of helping patients. We want to make certain this bill is tailored to address the issue at hand and not create new problems that increase healthcare costs and premiums for everyone, those patients included. So on behalf of the ranking member Walden, we appreciate your commitment to working across the dais on this issue and hope that we can continue that work before we mark up at a full committee, and I'm happy to yield to the chair.
Thank you. And let me say, obviously, this bill deals with covering medically necessary treatment resulting from congenital abnormalities. About 3% of American children are born with these abnormalities or birth defects that affect the way they look, develop, or function, often for the rest of their lives. And these children require serious medical treatment that is often not covered by health plans, either because it is deemed cosmetic or because the treatment involves dental services. However, it's critically important and medically necessary for children with these serious dental anomalies to be treated. So I understand the Republicans' concerns and happy to continue discussions to full committee. I think we can get the policy right and ensure that children with these congenital anomalies get the necessary medical treatment they need, and we'll work on this as we proceed to the full committee. Thank you.
Reclaiming my time, I thank the gentleman for his consideration and yield back the time.
The gentleman yields back. I recognize myself to strike the last word. I understand the ranking member's concern specifically that the legislation could have on premiums or budget requirements, and I, of course, will work with everyone to advance the bill. But there's something that I'm very sensitive about when it comes to insurance and this word where other things such as cosmetic will be, a cosmetic truck will be driven through an insurance company. Many, many years ago, I wrote legislation, it became law, and it related to women who had mastectomies. They were insured, but insurance companies would not cover the mastectomies because they considered it cosmetic. So I have a real sensitivity in this issue, so I think we have to remember the original reason why we're doing this bill, because health plans are actually currently exploiting loopholes to avoid paying for medically necessary procedures. We want to stay in that lane, but I don't want to see any loopholes like I saw years ago when it came to women and mastectomies. What an insult to women in the country, that if they chose to have mastectomy, that they were that it was considered cosmetic, and go pound. So, are there any other members that? Yes, the gentleman from Virginia is recognized.
Thank you, Madam Chair. I appreciate it. Look, I agree with everybody else that we want to take care of ectodermal dysplasia. I have a constituent who suffers from this and passed it on to 2 of his children. That being said, if we're doing good legislation, we have to read these bills carefully, and I would draw everybody's attention to page 3, lines 13 through 18. and it says there, due to congenital anomaly or birth defect, and shall include treatment to any and all missing or abnormal body parts, including teeth, which I'm all for, the oral cavity and their associated structures. And the purpose of the bill was to take care of the phrasing that I like that my friend from Florida, Mr. Bill Rockus, had in his statement was craniofacial anomalies. And I like that statement, and that may be an area, Mr. Chairman, Mr. Ranking Member, and Madam Chairman of this subcommittee, that might be an area that we could look at, that language, craniofacial anomalies. If you also look at page 2, lines 23 and 24, it says, restore any body part that is medically necessary to achieve normal body functioning or appearance. I suspect that while we all want to take care of these big issues, that there are a whole lot more issues out there that this would cover than we realize. So I've gotten permission from my wife to talk to you about her congenital anomaly, birth defect, that deals with a missing part. She doesn't have fingernails on her index fingers. Now, is this a huge deal? No. Should we be forcing all insurance companies to carry it? No. Is it an abnormality that fits the definition currently in the bill? Yes, it is. It's something that she's been teased about. It's something that actually, when we were taking out the Christmas tree this year, she said, let me have your gloves. I didn't even think about it. I said, sure, but why? She said, if I get a needle on that fingernail, it hurts like crazy. Yeah. So it meets the current definition, but I'm afraid if we open it up to the current definition, that we will have made it so broad that we will actually have an increase in insurance costs. My personal belief is that if we just dealt with those craniofacial anomalies like ectodermal dysplasia, the cost would be fairly minimal because we don't have that many people who are affected by it. But for those families who are, it is a huge expense. And it's not just a matter of putting on gloves when you're taking out the Christmas tree or having slightly deformed fingers because of the injuries you've gotten over the years. It's more serious than that. And so I don't want to downplay the purpose of the bill, but we have to get the language right. And I would suggest that we have our crack teams of lawyers, et cetera, take a look at that language that Mr. Bill Rockus used, craniofacial anomalies, because that's where the bill is trying to get. And I'm 100% supportive of that. And with that, I yield back.
The gentleman yields back and appreciate the comments that he's made. Are there any other members that wish to speak on this? Seeing none, the question now occurs on favorably reporting H.R. 1379 to the full committee. All those in favor of forwarding H.R. 1379 to the full committee will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. H.R. 1379 is forwarded to the full committee. The chair now calls up H.R. 2477, the Bennies Act of 2019. The clerk will report the title of the bill.
H.R. 2477, a bill to amend Title 18 of the Social Security Act to establish a system to notify individuals approaching
Without objection,
Medicare
the first reading of the
eligibility.
bill will be dispensed with. The bill is now considered as read. Without objection, the bill is considered as read and open for amendment at any time. I will now recognize Mr. Ruiz to offer an amendment in the nature of a substitute.
Thank you. I have an amendment at the desk.
What is the amendment labeled?
I got it. We have it.
You have it?
Yes, ma'am.
Okay.
Okay. I want to thank you for including this.
The clerk will report the amendment.
Okay.
Please.
Amendment in the nature of a substitute to H.R. 2477, offered by Mr. Ruiz of California.
Without objection, the reading of the amendment will be dispensed with, and Mr. Ruiz is recognized for 5 minutes.
Thank you. Thank you for including this important piece of legislation in this markup. And I would like to thank my Republican co-lead, Congressman Bill Rockus, for leading this effort with me, along with our champions on the Ways and Means Committee, Congresswoman Wolarski and Congressman Schneider, and our leaders in the Senate, Senators Casey and Senator Young. This has truly been a group effort across party lines, committees, and chambers. The Bennies Act will help seniors navigate a sometimes confusing Medicare enrollment process and cut down on coverage gaps for Medicare Part B. It will also help ensure that seniors are not paying higher premiums because they missed the deadline. Specifically, this bill will require the Social Security Administration to notify individuals nearing Medicare eligibility whether and when they need to apply for Medicare Part B. It also closes gaps in coverage that currently can leave seniors without coverage for several months after they sign up. When to sign up for Medicare and what parts you need to sign up for can be confusing, particularly for individuals who continue to work past the age of 65. But in the current system, if you don't sign up for Medicare Part B within 3 months of turning 65, regardless if you retire or not, you might end up paying a late enrollment penalty through higher premiums for the rest of your life. And the longer you wait to sign up, the higher that penalty is. So it's important that people don't sign up late. This bill will help ensure that they don't. This amendment in the nature of a substitute is mostly technical in nature and reflects input from the other committees of jurisdiction, as well as technical assistance from CMS and the Social Security Administration. The amendment pushes back the enactment date to 2022 to give agencies the necessary time to implement these changes and changes the number of times the notices will be sent. The amendment also removes a requirement to align the Medicare Part B general enrollment period with other open enrollment periods under Medicare. Instead, we will require a report on how to best align the open enrollment periods so we can ensure that any changes to the enrollment periods make the process simpler and do not have unintentional negative consequences for seniors. So I urge my colleagues to support this amendment and the Bennies Act to help ensure that more of our seniors get coverage when they need it without being forced to pay a lifetime of higher premiums. Thank you, and I yield back.
The gentleman yields back. Are there any members that wish to speak to the amendment of let's see, who was first? The ranking member, Dr. Burgess, you're recognized.
Move to strike the last word. Not so much speak on the amendment. On behalf of the ranking member, I did want to enter some comments into the discussion, and not really a colloquy to the chairman, but the ranking member Walden wanted me to express our desire to work through a minor issue that we have on this bipartisan bill. Medicare Advantage plans and other private insurance options can play a big role in helping beneficiaries avoid late enrollment penalties. And we'd just like to ensure that these options are also presented and available to the beneficiaries as part of this bill before we mark up at full committee. And again, the comments were directed toward the chair. I'm sure someone will relate them, and I'll be happy to yield back my time.
The gentleman yields back. Are there any other members that would like to speak to the amendment? The gentleman from Florida, Mr. Bilirakis.
Thank you,
have
Madam
5
Chair.
minutes.
I move to strike the last word.
So ordered.
Thank you. Madam Chair, the Beneficiary Enrollment Notification and Eligibility Simplification Act is a necessary step to modernize and simplify the Medicare Part B enrollment process. And I want to thank the lead sponsor, my good friend Dr. Ruiz, for doing this with me. Unfortunately, complex and confusing Medicare enrollment rules combined with a lack of notification cause tens of thousands of older adults and people with disabilities to incur lifetime fines, coverage gaps, and other harmful consequences. With fewer people automatically enrolled in Medicare and 10,000 baby boomers aging into Medicare each day, more people, again, new to Medicare must actively enroll in the program. In 2018, 760,000 people with Medicare were paying a Part B late enrollment penalty, which amounted to nearly 28% increase in their monthly premiums. This can be especially burdensome for many Medicare beneficiaries living on fixed incomes and can potentially lead to worse overall health outcomes. To address these issues, the Bennies Act directs the federal government to provide advance notice to individuals approaching Medicare eligibility about basic Medicare enrollment rules. It also directs Part B insurance to begin the first of the month following one's enrollment during both the later months of their initial enrollment period and during the general enrollment period. It also enables the federal government to create a Part B special enrollment period for exceptional circumstances. And that could apply today with the virus. A provision currently used in Medicare Advantage and Part D when people are unable to sign up for Medicare due to occurrences like hurricanes and other natural disasters. I thank my colleague, Dr. Ruiz, for including me. I also thank him for his leadership and partnership in this bill, and for the committee for working with us to continue to advance the Benny's Act through the legislative process. I urge my colleagues to support this common sense protective measure for seniors and those living with disabilities. Thank you, Madam Chair, and I yield back.
The gentleman yields back. Are there any other members who seek recognition? The gentleman from Oregon is recognized. Mr. Schrader for 5 minutes.
Thank you, Madam Chair. For possible amendment to the amendment, likely offered and withdrawn. Comment briefly, if I may.
Do we have it? Does the clerk
We have it, Madam Chair.
You do have it?
Yes, ma'am.
All right. The clerk will report the amendment, please.
May I ask, is this to the Ains or is this to the underlying bill?
I believe it's to the,
Do we have an Ains? I'm sorry.
be the Ains at this point.
Okay. All right. Amendment to the amendment to H.R. 2477
Without
offered by
objection, the
Mr.
reading of the amendment
Schrader.
will be dispensed with, and Mr. Schrader is recognized for 5 minutes.
Thank you very much, Madam Chair. Very grateful to my colleague, Mr. Ruiz, for working to resolve some of the confusion around signing up for Medicare. As he's pointed out, it can be very confusing, and his bill streamlines the communications to our seniors on the enrollment processes, very, very much needed. My amendment builds on that effort and would create a new special enrollment period for seniors who maintain COBRA coverage after the age of 65, so they can actually enroll in Medicare Part B without facing unfair penalties. A constituent of mine, Bill Bergman, came to me when he tried to enroll Medicare Part B after his work-based COBRA coverage expired, only to find out that he faced huge penalties. Ironically, he had asked if he could switch to Medicare without problems at the time his employer offered him the opportunity to stay on the company's plan through COBRA for 2 years. He was told there'd be no problem, but his COBRA coverage expiration did not dovetail with a Medicare enrollment period. As a result, he was fined when he tried to sign up and had to go without coverage until the next sign-up period occurred. My bipartisan bill, H.R. 2564, with my colleague, Mr. Bill Rockus, provides a permanent remedy to folks who face barriers to enrolling in Part B and those penalties due to electing to utilize COBRA coverage after they are Medicare eligible. The conclusion of COBRA coverage would be a qualifying event for a new special enrollment period, and they would not be penalized for delaying enrollment in Part B. We're working with CMS and CBO to get the right technical assistance at this time. Similar to Mr. Ruiz and Bill Rockus' bill, my bill will directly address the COBRA loophole problem that many Americans are facing. This issue has been around for a long time. It's time to put it to rest. Since we're waiting for input from CMS and CBO, I'm willing to withdraw my amendment if the chair is willing to work on this issue with me and find a path forward before full committee.
I'd be happy to work with the gentleman.
But the gentleman yield before he withdraws. This is an extremely important topic, and I do appreciate you working on it. It sort of came up during our legislative hearing, but not quite. So I'm glad you've brought it forward, and I hope you do get the technical assistance from the agencies, because we do need to make this right. I yield back to the gentleman.
Well, thank you, and I thank the chairwoman. Look forward to working with you. It's good policy, and let's get it done.
It is good policy, and we thank the gentleman who yields back and withdraws his amendment. If there's no further discussion or amendments, we'll proceed to a vote on the amendment in the nature of a substitute. All those in favor of the amendment in the nature of a substitute to H.R. 2477 will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. The amendment in the nature of a substitute to H.R. 2477 is agreed to. The question now occurs on forwarding 2477 as amended to the full committee. All those in favor of forwarding H.R. 2477 as amended to the full committee will signify by saying aye. Aye. All those opposed will signify by saying no. In the opinion of the chair, the ayes have it. H.R. 2477 as amended is forwarded to the full committee. Okay. We're almost there, colleagues. The chair now calls up H.R. 5534, the Comprehensive Immunosuppressive Drug Coverage for Kidney Transplant Patients Act of 2019. The clerk will report the title of the bill, please.
H.R. 5534, a bill to amend Title 18 of the Social Security Act to provide for extended month of
Without
Medicare
objection,
coverage.
the first reading of the bill will be dispensed with, and the bill is now considered as read. Without objection, the bill is considered as read and open for amendment at any time. The chair will now recognize the ranking member to offer an amendment in the nature of a substitute, and the clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 5534.
Without objection, the reading of the amendment will be dispensed with, and Mr. Burgess is recognized for 5 minutes.
Thank you. And I mentioned in my opening statement, this bill does provide Medicare coverage of immunosuppressive drugs for kidney transplant patients past the current 36-month limit. This makes much more sense than the status quo, which Medicare pays for dialysis and up to 2 kidney transplants. If the graft is rejected, dialysis is much more expensive and negatively impacts a person's life. This amendment in the nature of a substitute includes technical changes to the bill to incorporate initial feedback from the Centers for Medicare and Medicaid Services and the Social Security Administration. We're still awaiting formal technical assistance that will make those changes at the full committee markup to ensure that the agencies can implement this new benefit and make it operational. Most notably, the amendment in the nature of a substitute also makes changes to the section of the bill that addresses the other forms of insurance coverage, including VA and TRICARE. These changes account for confirmation from the agencies that TRICARE for Life already covers immunosuppressive drugs, as does the Veterans Administration. We are awaiting confirmation from the Indian Health Service, but do not anticipate that we would have to create an exception for those individuals. This amendment also adds a Government Accountability Office study on the implementation of this benefit, so I do urge members to support the amendment to the nature of a substitute and the underlying bill. And I yield back.
The gentleman yields back. Are there any other members who seek recognition to offer an amendment to the amendment in the nature of a substitute? Not seeing or hearing any. We will, all right, all those in favor of the amendment in the nature of a substitute to 5533 will signify by saying aye. Aye. All those opposed, in the opinion of the chair, the ayes have it. The amendment in the nature of a substitute to H.R. 5534 is agreed to. The question now occurs on forwarding 5534 as amended to the full committee. All those in favor of forwarding H.R. 5534 as amended to the full committee will signify by saying aye.
Aye.
Aye. All those opposed will signify by saying no. The opinion of the chair, the ayes have it. H.R. 5534 as amended is forwarded to the full committee. The chair now calls up H.R. 3935, the last bill we're taking up. Colleagues that are patient and hanging in there. The Protecting Patients Transportation to Care Act. The clerk will report the title of the bill.
H.R. 3935, a bill to amend Title 19 of the Social Security Act to provide
Without
for the...
objection, the first reading of the bill will be dispensed with. The bill is now considered as read. Without objection, the bill is considered as read and open for amendment at any point? Are there any members who seek recognition? The gentleman from Georgia, for what purpose do you seek?
Move to strike last word.
So ordered.
Madam Chair, I want to first thank my colleagues for considering this legislation. By way of background, current federal Medicaid regulatory framework requires states to include non-emergency medical transportation benefits for Medicaid beneficiaries. The key to this program is the access to care it provides. Preventative care measures help keep patients healthier and reduce costs, but without proper transportation, many patients simply can't make it to their doctor. Worse yet, without transportation, patients may choose to forego care until it's too late, resulting in a 911 call and a trip to the ER for something that could have been avoided. Each year, more than 100 million rides are taken by patients through this benefit, and it only makes up 1% of Medicaid spending, despite 7% of beneficiaries using it. My legislation would codify this regulatory statute, ensuring the transportation benefits Medicaid beneficiaries receive stay in place. My colleagues here should also know we continue working with stakeholders to include program integrity language in the bill for a full committee markup. I repeat, we continue working with stakeholders to include program integrity language in the bill for a full committee markup. This will further ensure the transportation benefit is not misused and we can provide proper oversight of it in the future. Thank you again, and I urge support for this legislation, and I yield back.
The gentleman yields back. Are there other members seeking recognition to speak on the amendment? Seeing and hearing none. The question now occurs on favorably forwarding 3935 to the full committee. All those in favor of forwarding 3935 to the full committee will signify by saying aye.
Aye.
Aye. Those opposed will signify by saying no. In the opinion of the chair, the ayes have it. $39.35 is now forwarded to the full committee. What else do we have here? Okay. Without objection, the staff is authorized to make technical and conforming, pardon me? Oh, okay. You're just having fun? That's all right. It's almost playtime, gentlemen. Okay. Without objection, the staff is authorized to make technical and conforming changes to the bills consistent with the actions taken by the subcommittee today. And are there requests? Yeah. The chair makes a unanimous consent request to enter documents into the record. And this is the list. I better start in. It's a long list. So this is the list for unanimous consent to be entered into the record. Statement from John Cahan, Chief Data and Analytics Officer for Microsoft, and Heather Cahan, President of the Aaron Matthews SIDS Research Guild of Seattle Children's. Letter from 16th Street Community Health Centers in support of H.R. 2271. Letter from American Academy of Allergy, Asthma, and Immunology in support of H.R. 2468. Letter from the American Academy of Pediatrics in support of H.R. 2271. Letter from the American Academy of Pediatrics in support of H.R. 4801. Letter from the American Society of Plastic Surgeons and the Plastic Surgery Foundation in support of H.R. 1379. Letter from Beauty Counter in support of H.R. 5279, one-pager on H.R. 1379, submitted by the National Foundation for Ectodermal Dysplasias Family Advocacy Committee, statement from Representative Madeline Dean on H.R. 4712, letter from the Mackenzie Blair Foundation in support of H.R. 2271, letter from the National Healthy Start Association in support of H.R. 4801, letter from 8 environmental groups advocating for cosmetics reform, letter from Children's Hospital of Wisconsin in support of H.R. 2271, an article written by Trish Bonner, Associate Director, Research and Development, Johnson & Johnson Family of Consumer Companies in support of cosmetics reform. Letter from the Health Industry Distributors Association in support of H.R. 5663. No objection? So ordered. I thank the ranking member of the full committee and another piece of paper. Without objection, the staff is authorized to make technical and...
You already read that, so you just have to adjourn.
Oh, we're done. I already said that. Well, for the two of us that are still here, the subcommittee stands adjourned.
Conduct other business.
Thank you. Thank you to all of the staff on both sides of the aisle. Subcommittee is adjourned.